question from different subjects. But sir, what is your opinion, sir? As a paper, whatever you saw in say ortho.
Absolutely. FMG is, we used to always say it is 70% of NEET PG or INICT. The gone are those days. It is
Right,
absolutely 100%. The advantage of this is that it will reflect into your results for your future preparation.
right. So
Second thing,
yeah,
we are seeing that the students are scoring up to 230, 240, 250.
right, sir.
Those students are clearing every exam.
100%.
So nobody in the world can take them lightly. वो discussion ही नहीं है अब. FMG, non-FMG, it is one of the exam. You have done MBBS from any place. You qualify this, you are in for any game anywhere in the world.
I was looking at some of the questions. I can definitely say this is a tougher paper than NEET PG last paper.
Yeah.
So I'm not sure about. Let us see what others faculties say. But for me, it was a pretty decent, moderate to difficult paper. And so what you said is a very genuine thing. It's a blessing in disguise, and that is why we are seeing FMG students are getting in top 10 in NEET PG, getting great ranks in INI-CT. So it's a blessing in disguise. So please you can start, sir.
Right. So let me share my screen. I've got a small presentation made. As Dr. Praveen said, due to limitation of time, we will be improving on the proper presentations in the app and releasing it subsequently. So I hope you can see my screen. So if you look at the questions here, the first question, I first of all, thanks to Cerebellum team for collecting those questions, organizing this session. I understand it's not easy, but if anybody can do it, it is the team Cerebellum which could have done this. And we are very blessed to just sit and discuss this. This was the first question which was universally given and discussed in our Telegram group. I have elaborated it. So they had spoken about a high-speed vehicle collision with dashboard injury. Friends, the moment you hear the word dashboard injury, the thing that should come to your brain is a posterior dislocation of the hip. We had done this discussion. We were sure about this coming in multiple exams, and they had given an image showing posterior dislocation where the head is above the acetabulum. They had given the options of acetabular fractures, posterior hip dislocation, anterior hip dislocation. I'm not very sure about the fourth option which was there, but for the completion, the team has given as intertrochanteric fracture. So this is something which came as an image in the exam, and I hope people got this correct. So this was the first one which was there. All right. Secondly, there was another mention in the Telegram group that there was a question on acetabular fracture. I'm not sure whether there was a separate question or the student who marked acetabular fracture were relating it to this question as there. Overlap between ortho and anatomy, and we always say that around the shoulder, right? Around the shoulder, the axillary nerve goes. Again, a very pet repeat question. This is also called as a regimental badge sign. A nerve injury question is always asked there. This time it was a normal relationship, that is anatomical relationship that was asked to you. So this is the second question which was there. I am just relating it to these are the set of questions which you expect in any exam in my country, whether it's NEET, it's INICT, or it's FMG. This is something which is going to be always there, right? The third question they had asked about, they had shown an image showing you of tibia or femur. There is a lot of discussion going on, but the majority of the students they say that the question was of the image of the tibia. So there was a tibial image, all right, and they had shown a history of osteomyelitis. So whenever you have a tibial image with osteomyelitis, what should come to your brain is Ewing sarcoma. Some students do mention they had given Codman's triangle, some say onion peel appearance. Either of the case, right? If it was tibia, if it was diaphysis, irrespective of the age, the answer is going to be Ewing sarcoma. If it was femur, if it was diaphysis, irrespective of the any periosteal reaction, answer is again going to be Ewing sarcoma. If they don't give you any periosteal reaction, they only talk about osteomyelitis like scenario, the answer obviously is Ewing sarcoma. But yes, if they talk about lower end of femur, which some students have mentioned, they show you Codman's triangle, then the answer is going to be osteosarcoma. So for all the purpose, we will take this question as Ewing sarcoma because majority of the students they mentioned that the question was about Ewing sarcoma. Just for a comparison, another view that came in the Telegram group. So I have kept this question. This is how an osteosarcoma question will look to you. Lower end of femur. The arrow points out to the triangle lifting up Codman's triangle, talking about the osteosarcoma. Then there was a question showing swelling of a metacarpal. I could not get in a short time the swelling of the second metacarpal bone which they had shown. But if they show you swelling of a bone, it should classically come to an enchondroma. I understand brown tumor can be there, but most common tumor of bones of hand and feet is enchondroma. That's a classical dictum that we should remember. So we have to remember that this is going to be a tumor of the finger or the digits, and we should mark it as enchondroma. Then we came on to the question that we came in the exam was about the swelling of the knee joint with multiple loose bodies. So whenever there's a swelling of the multiple loose bodies that comes to you, that is going to be marked as synovial chondromatosis. Now, this is something which is out of the box. I don't expect anybody to answer this question. Fortunately, it's a part of our PDF of the main class, the marathon, and that everybody. But trust me, it is something which is being asked beyond 10 years. We always say that in cerebellum, last 3 years is a must. Doing 5 years is preferable. Dr. Praveen has been advocating that 10 years is something that should get a grip on. This was beyond 10 years. Fortunately, I did not delete this image of synovial chondromatosis of the knee and the shoulder from my presentations. This came from the presentation, but honestly, it is long gone PYQ. That is how we should relate it. So these were the questions that came. There were some very obvious questions that came in the exam. They had spoken about the shoulder ossification, which was about 18 years of age. But this is something which is there. We will be talking about things in detail when we get you a proper presentation of the recall with better options. But just to set the tune and pass on to better to none better than universe boss, right? Let's have a look at the questions he's going to talk about psychiatry. And one more thing which I want to tell you here is, which is very important, as he pointed out, the questions were spot on. They were clinical. Ortho is principally has been image based, and they were image based questions. All the very best to all of you for your results. Just like the last time, we are expecting a great result this time also, and even better, because we have seen the students keep on surprising us. Best wishes from the whole Cerebellum team, the faculties, and thank you very much for having me here. Thank you. Over to you, Universe Boss.
Just a second, students. I'm just trying to. All right, here it is. Share. All right. Is my slide visible?
Yes, it is visible.
All right. All right. Thank you, sir. Thank you, Apur, sir. All right, students. So again, this is like a very preliminary question that I have received, and I would need a bit of your help in finding out the exact wordings. Okay. So this was the first question. A patient with suspected morphine overdose is brought to the emergency department, and which of the following is most characteristic? So, I think this one is a simple question. We know that in opioid overdosage, we have respiratory depression, we have cyanosis, we have serious depression. So tachycardia, of course, not possible. In opioid overdosage, meiosis, constricted pupil is what we see, and hypotension is what you see. Bradypnea is the answer. I'm sorry, my marker is not working. So bradypnea is the answer. B is the answer here, right? Tachypnea and bradypnea is there. Okay, so if tachypnea and bradypnea were there, so that would become the answer. This is an easy question. Again, this is a favorite topic of FMG examiner and NEET PG examiner. They always ask a question on one of the perversions. So, person getting sexual gratification by wearing clothes of the opposite gender. Uh, can you help me with the other options? Was transvestism in there? Was transvestism in there? So if transvestism was in the options or eonism was in the option, that becomes the answer. Okay, so one of the option was fetishism, right? Fetishism, eonism was there in the options. Eonism was there in the options. Okay, so eonism is the answer. Eonism is the answer. So in that case, this is a repeat from INICT paper. I think 2 years back in INICT, they gave the exact same question. Sexual gratification by wearing of clothes of opposite gender. And rather than giving transvestism, they gave the option of eonism. So as students are saying, fetishism, eonism, and exhibitionism were in the option. The answer becomes eonism. We did cover this in our class in the FMG Mission 200 Plus class. So I think you must have gotten it right. Eonism. All right. Now this is again, I mean, not a difficult question for sure. I'm sure all of you got it right. A patient who has alcohol dependence took alcohol after taking the prescribed drug, and now is developing symptoms like discomfort, bloating, distension, all of this. And I think disulfiram was there in the option. So straightforward disulfiram ethanol reaction. This is disulfiram ethanol reaction, right? Can you help me with the other options? What were the other options? ये तो कर लिया होगा डाइसल्फिराम, सिंपल सा है. My guess is examiners are taking the questions from past years, putting them in the chat GPT and making 3 lines out of it. मुझे तो लग रहा है यही हो रहा है, because the kind of language that is coming quite typical. But अच्छा है, ठीक है. So that tells us that PYQs are still important, but now that they would ask them in a clinical manner. So disulfiram is the answer. Can you tell me with the other options? What were the other options? Fomepizole. Okay. So fomepizole, of course, not the answer. What were the other options? TCA. Okay. TCA, fomepizole. What else? Chlorpromazine. Okay. So we had options disulfiram, chlorpromazine, TCAs and fomepizole. The answer is of course disulfiram. Straightforward question. अच्छा इसके ऑप्शंस बता दो मुझे यार. अ पेशेंट विद स्किज़ोफ्रेनिया रिपोर्ट दैट हिज नेबर्स आर कॉलिंग हिम एंड कंट्रोलिंग हिज एक्शंस. ऑप्शंस क्या थे इसमें? व्हाट वर द ऑप्शंस? व्हाट वर द ऑप्शंस यहाँ पे? व्हाट वर द ऑप्शंस फॉर दिस क्वेश्चन, स्किज़ोफ्रेनिया क्वेश्चन? व्हाट वर द ऑप्शंस? Delusion. Okay. And other options? Illusion. Oh, okay. डिल्यूजन, इल्यूजन, हेलुसिनेशन. ओके. तो फिर तो ये भी सिंपल हो गया. तो अपने साइकेट्री क्वेश्चन तो काफी स्ट्रेट फॉरवर्ड हो गए. आई थिंक ऑल ऑफ यू मस्ट हैव गॉटन इट करेक्ट. आई थिंक देयर वाज अ क्वेश्चन ऑन लिथियम आल्सो दैट याजी सर विल कवर. So these were the questions that I was able to find in psychiatry. There was another question where they were saying a girl was being bullied for many years. I could not really get the exact language. So if anybody can tell me the exact language, we can discuss that also. बट ये 4 क्वेश्चंस तो आई एम श्योर यू मस्ट हैव गॉटन इट करेक्ट. इल्यूजन, डिल्यूजन, हेलुसिनेशन अगर इसके ऑप्शंस हैं तब तो ये आसान हो गया. तो दिस इज क्लियरली डिल्यूजन ऑफ कोर्स. चौथा क्या था? ऑब्सेशन तो नहीं था? दे आस्क फॉर हाउ विल यू डिफरेंशिएट स्किज़ोफ्रेनिया फ्रॉम डिल्यूजन. सेकंड हैंड कमेंट्री, थर्ड हैंड कमेंट्री बेबी था एक. अच्छा. देयर वाज अ क्वेश्चन ऑन एडजस्टमेंट डिसऑर्डर आल्सो. ओके. चलिए ठीक है. आई थिंक 1 or 2 क्वेश्चंस मोर वर देयर. विल फाइंड इट आउट. एंड एज अ पूर सर वाज सेइंग, वी विल गिव यू द फाइनल वीडियो which has the actually record question with the proper options. अच्छा, एक रैबिट सिंड्रोम के ऊपर भी था. ओके. सो वाज देयर अ क्वेश्चन ऑन टार्डिव डिस्काइनेसिया, रैबिट सिंड्रोम? ठीक है. ठीक है. I'll have to collect these questions. Okay, Apoor sir is here. Sir, do we have the third person?
Yeah, we just check out. So what I realized from your question also, they were clinical, relatable from
Yes, sir.
lectures, correct?
Right, sir.
Absolutely spot on.
Right.
I've got one more question that says about the football injury and the ACL tear. They had shown the images. So what I realized as we go for the next 48 hours, we'll be glued to things. For a teacher, after the exam is over, the exam starts. How we did, how we were able to help the students or not. And then we keep on reading the things. But what we really understand is that the exam was mainly clinical. In part 2, it was image based and it was not single liner. They had actually given what is more commonly seen in your clinics, in your internships, in your wards, and that is absolutely asked. So that was being honored here, and that's how NICT and NEET PG also works. I
Right.
think Dr. Anand is going to be the next, Dr. Praveen. So he's there.
Right, sir. All right. Over to Anand, sir.
Thank you. Thank you, sir. Good evening and regards. My name is Dr. Anand. So let's start this beautiful FMG recall. Wonderful questions, very simple, to the point. Let's finish it off. So number one, very importantly in the FMG recall, the first question we had over here is a preterm baby with the complaints of breathing difficulty and chest X-ray is shown below. So the answer for this question was a whiteout lung, which is seen in a case of hyaline membrane disease, number one. So whiteout lung, HMD. One more question was there. A baby came with complaints of pain, abdomen, arthralgia, and rashes, specifically in the lower limbs. So pain, abdomen, arthralgia, and rashes, specifically in the lower limbs. We are talking about Hinong Schonlin purpura. This question was there. A child came with third question was there, which is of our thanks to our mission FMG classes, everything was spot on accordingly. That only. A child came with complaints of bluish spot on the buccal mucosa. So the answer for this question was measles. So measles has cuff coryza conjunctivitis and bluish spot on the buccal mucosa. This was an interesting question actually. A baby with persistence of asymmetric tonic neck reflex will not able to achieve which of the following milestones. So number one, we have done in our classes, this is known as ATNR, asymmetric tonic neck reflex, which is also known as bow and arrow reflex. If I turn the baby head to one side, one limb will extend and one limb will flex. So normally what happens, ATNR disappears by 6 months. And why nature is causing disappearing of ATNR by 6 months? Because so that the baby can roll over. So rollover starts to come by 6 months and ATNR disappears by 6 months. So that is why if persistence of ATNR is there, the child will not be able to roll over. 6 महीने के बाद ये रिफ्लेक्स खत्म हो जाता है और बच्चा अपने आप रोल करता है. तो 6 महीने के बच्चे को अगर आप एक तरफ टर्न करोगे तो वो बो एंड एरो शो नहीं करेगा, वो चुपचाप रोल ओवर करेगा. तो दैट इज व्हाई दिस इज द आंसर. Next question, ductus venosus is a bypass channel which passes the liver and continues as what? Very interesting question. We have done that in fetal circulation. Ductus venosus is a bypass channel, definitely yes, we know, which passes the liver, which basically bypasses the liver and continues as what? So ductus venosus, we all know it continues as inferior vena cava, and we have done that in our fetal circulation chapter. A child with cyanosis and clubbing and chest X-ray shown below. So cyanotic congenital heart, we all know ASD, VSD, PDR, acyanotic congenital heart. Tetralogy of Fallow, basically boot-shaped heart. This was the question X-ray had given. So tetralogy of Fallow. This is not TGA because it is not egg on side appearance. One student had told me, Karthik Dua had told that VSD पे question आया था और पूछा था कि कौन सा मर्मर होता है. So exact question though I don't know, but they were saying that the child with recurrent cough and cold and acyanotic congenital heart suggesting of VSD. Which of the following murmur is seen? So VSD will have a pansystolic murmur and PDA will have a continuous machinery murmur. This question was spot on. Was there a baby with rashes with pleomorphic rash? Pleomorphic rash means all the stages of rashes are present at the same time. The answer is chickenpox. We have done that in our classes very beautifully. This was a very interesting question, that what is the use of MDI in asthma? As in not exactly the MDI, but definitely the spacer. ये spacer का क्या function होता है? This is a MDI, this is a spacer, and then we usually have a mask. So spacer ka exact options I'll not give, but the right answer is this. It reduces the oropharyngeal deposition. I tell the patient to use spacer while using the MDI. So basically it reduces the oropharyngeal deposition and reduces the speed of aerosol particle for a better deposition in the lungs. मतलब स्टूडेंट ने कहा था, ये लाइन लिखी हुई थी, it reduces the oropharyngeal deposition. Yes, that's right. डायरेक्टली इनहेलर लेंगे तो माउथ पे डेपोजिट हो जाता है, इसलिए स्पेसर अगर लेंगे तो लंग्स तक जाएगा. Okay, then there was a question on pneumonia and regarding one consolidation in pneumonia, consolidation question they had asked. And this question was there regarding ITP. A child came with complaints of fever with rashes seen in lower limbs. Then on hematological investigation, PT, APTT were normal, but platelet count were reduced and peripheral blood smear shows increased megakaryocyte. Like this is a recall, not exactly, but the answer was ITP. ITP pe question aaya tha. The question was there on idiopathic thrombocytopenic purpura. Okay. okay, this is what they had asked in exams. They said it was a obs-gynae question, but the answer was transient tachypnea of newborn. A newborn baby born to LSCS came with breathing difficulty with X-ray showing fluid in the interlobar fissure. So fluid in the interlobar fissure, it is seen in TTN, and the student had told that it was an obs-gynae question, but the answer was transient tachypnea of newborn. So these were the questions, and one more question, last question was there on UPGAR score. Exact question detail I don't know. Thoda sa hi aaya hai abhi. It is the little bit information I have, but yes, there was a question on UPGAR score which we have done 1,000 times in our mission FMG classes. So that was all about regarding Pete's questions. Thank you so much, everyone. Best of luck. I know the result will be awesome. Now the next participant / faculty will take over the lecture. Thank you so much.
Thank you, Dr. Anand.
Thank you, ma'am.
Okay. I'll just share my screen once again. Is my screen visible? Second.
Not yet, ma'am.
One second.
Yes,
Okay.
it's visible now.
Okay, so hello everyone. I think micro was very, very direct. I don't know about other subjects. People are saying exam was moderate to difficult, but I believe for micro, everything was from the notes. I don't think anything came out from it. So you must have answered everything from micro. So in the first question, what I was able to gather, there are around 14 to 15 questions related to micro. So the first question was for the like a farmer working in the rice fields, and he had conjunctival suffusion. So we all know, and multiple time conjunctival suffusion is the buzzword, and also had icterus, and you had to name the disease that is causing such symptoms, and we all know that this is caused by leptospira, right? It is caused by leptospira, and the name of the disease is called as the Weil's disease, which is the icteric hemorrhagic fever that we get in leptospira. So I got this this option, but I did not get the other option. So can you very quickly help me with the other options as well? So rice field, icterus, conjunctival suffusion, definitely it's Weil's disease. But what were the other options that were given here? Can anybody help me? What phase of the disease was asked and not the disease? Okay, so what phase? But people were telling me Weil's disease was given in the options. So what phase of the disease? Okay, so Weil's disease was not in the option. It was one of the parts in the question only. Very quickly, guys, please help me. Okay. Icteric phase, liver. Okay, so they had given this icteric phase and liver. Phase was asked. Okay, got it. Fine. I'm going to move on to the next one. A patient presented with Burkitt lymphoma, and then Pond-Bunel test was performed to confirm the organism. For which organism is the test done? I believe this is what was given. And the answer is going to be obviously Epstein-Barr virus, right? Epstein-Barr virus was there. Leptospirosis was given. Okay. Leptospirosis तो mild वाला होता है. It is not the Weil's disease. Weil-Felix reaction. Okay, Weil-Felix was given to confuse you guys with the Weil's disease. That's great. Okay, got it. ठीक है. On convalescent phase was also given. ठीक है. So this was Epstein-Barr virus. Everybody got this correct. Great. I'm going to move on. If you can help me with the other options, please do tell me. Rickettsia provozaki and Epstein-Barr virus is what I got. Did not get the last two options. If you're able to help me. Icteric convalescent. Okay, great. Icteric convalescent. Okay, great. Moving on to the next one. What process does this organism in the image perform? So very, very easily, I don't know if this is the exact image, but this is what is a bacteriophage, right? And I always told them that this dancing person is what? It does the transduction, right? So answer was option B, which was your transduction. Acha, CMV was given. ठीक है. CMV was also given. ठीक है. So this was going to be your transduction, which is the bacteriophage. Moving on to the next one, X and V factor in the media is used to grow which of the following organisms? So we all know that this X and V factor is required for this one person, which is your Haemophilus influenza, because it requires both these factors. Either they can get it in the chocolate agar or they have the selective medias for it, right? So I think these were, I am not sure if these are the exact options, but Haemophilus though is the answer for it, right? Simple, moving forward. ठीक है. Truck driver presented with single painless ulcer on the penis and around the corners of the mouth. Please help me with this. Influenza was also there in the option. तो हाँ, hemophilus influenza. Okay, so there was just influenza also there. ठीक है, तो they had tried to confuse you a lot with like, similar sounding options. But ठीक है, that is not the answer. Okay, so truck driver with painless ulcer on the penile area and around the corners of the mouth. What is the name of the disease causing this? Is this the question? Is this the question? So, and syphilis was the answer, but did they ask you the organism or did they ask you the disease? Okay, even if it was a she, Ducry was also given. Okay. Wasn't Ducry like a separate question, guys? Okay, primary syphilis. So did they talk about the secondary syphilis around also? Around the lips था, ठीक है. Mouth नहीं है, lips है. Got it. Primary syphilis हो गया, ठीक है. Then herpes, hemophilus ducrei. Did they give secondary syphilis and all also? ऐसा करके कुछ था and candida दिया हुआ था. ठीक है. चलो, तो we know that syphilis is the answer. Simple. Patient presented with a painful genital ulcer. There was another question on genital ulcer and undermined edges. Was undermined edges given? Primary syphilis, secondary syphilis भी था ऑप्शन में. Okay. Secondary syphilis भी था ऑप्शन में. ठीक है. Okay. Okay, some people are saying नहीं, सिर्फ primary दिया हुआ था. Okay, anyway, guys, I'm going to move forward. I will come back to it. Patient with genital ulcer, painful, undermined edges दिया था कि नहीं? And what is the name of the organism? Because painful ulcer can go two ways. It can either be herpes and Haemophilus ducrei. Now, people are telling me कि मैम आंसर तो Haemophilus ducrei था, but please tell me what was the other things? Painful lymphadenopathy भी था. Okay, but painful lymphadenopathy again, guys, is seen in both. Did they give multiple? Did they say something else regarding it to make it like maybe undermined edges, maybe vesicle fluid fill, painful ulcer and lymphadenopathy? कुछ नहीं था. HSV था ऑप्शन में. HSV था ऑप्शन में. Multiple was given. Okay, multiple is still. फोटो भी दिया था. Okay, if there was a photo, then तो the disease is done. HSV नहीं था. चलो, if HSV was not there, then definitely we have come to the answer of Haemophilus ducrei. Got it. Photo, I'll see. I'll check for the photo. Chancroid was in the option. ठीक है. एक ही बात है. Got it. HSV नहीं था तो बात खत्म. It's the Haemophilus ducrei or chancroid. ठीक है. Patient presents with fast moving serpentinous rashes on the body. What is the organism? Please tell me if it is the, or did they ask the organism or did they ask what is like, were they asking larva occurrence? Were they asking larva occurrence or were they asking the organism? Okay, image was given in this also, serpentinous वाली, that is fine. Klebsiella था option में. Klebsiella granulomatous होगा, ठीक है. Donovanosis, that is fine. Please, is organism. So strongyloid circularis तो organism हो गया. But what are the other options in this? And Chylosoma brasilensis. Okay, that is causing cutaneous larva migrants, not larva occurrence. This is larva occurrence, right? ये current है because they are saying fast moving. Fast moving is like, remember मैंने कहा था current की तरह it will go, so that has to be strongyloids. Brasilensis is causes cutaneous larva migrants, but it is very slow. Photo of the organism. इसमें भी photo था क्या, guys? And chylostoma हो गया. Tell me, please try to tell me the 3 new names थे. चलो छोड़ो. I'll try to figure that out. Okay. The reduced use of this led to the decrease of which parasite? Although this is something that might be taken up in PSM, but this reduced use of these step wells. These are called as step wells. Right? People used to walk inside these wells. इसके अंदर जाके they used to collect water, and there was one worm that used to kind of come out when you ever stepped into this well, and that was your guinea worm. Right? We have already eradicated, rather eliminated and eradicated it. Dracunculus is the name, and the other name for it is guinea worm. No cyst, no ova, only larva present. ये लिखा था. No cyst, no ova, only larva. ये तो they are talking about strongyloids only then, guys. Guinea worm का other name is Dracunculus, which is what is we have eliminated and eradicated because of the step wells that were kind of stopped. Okay. ये बहुत weird था. This was weird for me because they were saying that ma'am wool sorter का history था, but also they had given black scar, which they are pointing towards scar. So usually तो ये cutaneous anthrax होना चाहिए, wool sorter में नहीं होना चाहिए था. Hide porters में it should have been for me, but anyway. Wool sorter with black eschar on the arm. What is the organism responsible for this? If this was the question, then obviously it is going to be Bacillus anthracis, which is causing this eschar kind of a thing, and obviously it also causes the wool sorter's disease. Okay, no wool sorter, guys. ये थोड़ा confusing है. That is why I am, having a question on this because wool sorter में तो pulmonary anthrax should have been there. So this was not there. Fine. I think somebody was confused. Rickettsia नहीं था option में. Somebody told me Rickettsia typhi was in the option. Escar tha which sheep wool? Okay, so there was somebody must have been carrying the sheep wool, which then got an escar. Okay, so it was sheep wool carrying wala people. So that is again Hyde Porter's disease also. Photo was also there. Okay, escar ka image bhi tha. A lot of image-based questions then, guys. Wool sorter was there. Wool sorter who must be carrying the sheep का wool ऐसा type का कुछ होगा. ठीक है. Wool sorter with carrying sheep wool must have gotten this cutaneous eschar. Got it. So Bacillus anthracis, but guys, please tell me the other options also. Only scar था. ठीक है. Black scar नहीं था. Only scar था. That is also okay. Scrub typhus. ठीक है. Scrub typhus was there. Rickettsia typhi was not there. Scrub typhus was there. Please help me with the other options also. Okay, नहीं था wool sorter, कोई बात नहीं. Eliminate the wool sorter. Please tell me other options. Anthrax था description में. And what do you mean by description में? Did they give bamboo stick appearance or something? Photo of the hand. ठीक है, hand में scar था. That is fine. Did they give like a bamboo stick appearance? That was not there. छोड़ो फिर. ठीक है, but the answer is Bacillus anthracis. Moving on. HIV patient had history of curdy white vaginal discharge, narrow budding yeast cells with pseudo-hyphae. Organism responsible, we all know it is Candida albicans. राइट. टेपरिंग एंड वाला वर्म था. टेपरिंग एंड वाला वर्म कहाँ था गाइस? ये वाला तो आई डोंट नो. टेपरिंग एंड worm, this though I don't know what you're talking about. I'll think about it. Okay, so this was what? Candida, yes. So even if somebody said ma'am cyst का कुछ पता नहीं budding का 4 to 6 micrometer का size भी दिया था, I'm not sure. But the moment you hear the word pseudohypha, it has to be Candida albicans, right? No other. KOH mount का show करेगा. ठीक है, हाँ, so वही माइक्रोस्कोपी में या KOH mount बोल दो, it's the same. Esophageal constriction, guys, ये esophageal constriction कहाँ से आ रहा है? Ma'am, one opposite question of Candida. Candida was description was in the options now you're saying. तो फिर question में क्या दिया था? Curdy white discharge was given and budding cyst was asked. Okay, so this was not Candida. They had given budding yeast with pseudohyphae here, I think. That is what you're trying to say, na? Okay. 4 to 6 micrometer tapering end wala. 4 to 6 micrometer. Okay. This I have to see what are they trying to say. 4 to 6 वाला histoplasma. This somebody said कि ये histoplasma नहीं था. This was something else. But guys, पता नहीं, बताना. Different question. I'll try to find it out. Okay. Immunocompromised patient presented with unilateral painful black necrotic scar on the right face. What will be the ideal treatment of this disease? Tapeworm whose tail is sharp in head too. ये तो अलग ही कुछ आ गया. Tapeworm with sharp tail and face. Okay. Weird. Moving forward then, हाँ, इसमें था black necrotic scar on the right face, unilateral painful. This was obviously your mucormycosis, and I had said multiple times that you always have to give antifungals and surgical resection has to be the thing. So antifungals with surgical resection. Narrow based budding था histoplasma वाले में. ठीक है, so you are saying this was a separate question. ठीक है, got it. But आ गया ना histoplasma answer, so that is good. ठीक है. Moving forward, foreigner came to the OPD with complaints of rice water stools after eating some street food. Then which toxin is responsible for this disease? The moment you hear the word rice water stools, obviously answer has to be the cholera toxin. है ना? ये तो बिल्कुल simple. Oil fried colony bita. हाँ, I'm coming to that. ठीक है, so this is cholera toxin. ये identify the organism that shows these colonies on the image. This was the PPLO agar, right? This question was not there at all. This question was not there. Cholera toxin. Somebody told me rice water stool wala question tha in a foreigner who had diarrhea and gave the history of rice water stool. Heat labile toxin of E. coli. ठीक है, E. coli toxin हो गया. Cholera था, तो cholera toxin हो गया है. तो ये question. Why is somebody saying मैम ये question नहीं था? Okay, there is a lot of confusion. Some people are saying ma'am it was there. Some are saying it's not there. ठीक है, ओके गॉट इट. पीपीएलओ अगार हो गया, ये फ्राइडे कॉलोनीज हो गई, राइट? फ्राइडे कॉलोनीज ऑन पीपीएलओ अगार एंड दिस वाज ऑब्वियसली गोइंग टू बी ऑन माइकोप्लाज्मा. ठीक है, इट वाज माइकोप्लाज्मा. ओके था नहीं था, इट्स फाइन गाइस, अब तो हो गया, छोड़ो, आगे बढ़ो प्लीज. ये माइसेटोमा तमिलनाडु पेशेंट प्रेजेंट्स विद मल्टीपल ड्रेनिंग साइनसेस, नॉट ट्रेनिंग, ड्रेनिंग साइनसेस आफ्टर थॉर्नप्रिक. आई एम नॉट श्योर इफ थॉर्नप्रिक का हिस्ट्री था कि नहीं. ठीक है, स्ट्रॉन्गलर्स के साथ एनकाइलोस्टोमा. ठीक है, व्हाट इज द ट्रीटमेंट चॉइस ऑफ द डिजीज? सर्जिकल डिसेक्शन गाइस. एम्पुटेट थोड़ी कर देंगे सीधा माइसेटोमा में. इट हैज टू बी सर्जिकल डिसेक्शन फर्स्ट. उसके बाद नहीं हो रहा तो एम्पुटेशन है, बट प्लीज इट हैज टू बी सर्जिकल डिसेक्शन. पीपीएलओ फ्राइडे क्वेश्चन ये हो गया. कंटैमिनेटेड कैंड फूड था गाइस. इफ इट वाज कंटैमिनेटेड कैंड फूड देन तो क्वेश्चन थोड़ा क्वेश्चनेबल हो जाता है. कैंड फूड का तो फिर वी हैव टू थिंक अबाउट द बोtulinum टॉक्सिन, बट राइस वाटर स्टूल था तो इट हैज टू बी कॉलेरा. चलो, anyway, this is going to be mycoplasma. Then surgical dissection is the answer here. Amputation is not the answer. Surgical debridement होगा, ठीक है, that is also the same thing. Right? This is all from my side. Antifungal with resection. Okay. Yes, then that would be the answer. If this was given, then this would be the answer. Because you have to give antifungals with resection. Canned food था तो botulinum वाला. Hyphae was there in biopsy. इसमें hyphae थे? इसमें hyphae दिख रहे थे. एंटीफंगल प्लस सर्जरी. हाँ, तो वही सर्जिकल डिसेक्शन इज द आंसर. स्ट्रोंगुलर्स के साथ एनकाइलोस्टोमा गाइस, वो मैंने लिख दिया ना. ओके, सो दिस इज इट फ्रॉम माय साइड. आई थिंक देयर वर अराउंड 14 क्वेश्चंस दैट आई कुड गैदर एंड नाउ आई एम हैविंग few more like histoplasma and all. I'll kind of combine them and thank you from my side. Zainab ma'am, I think you can take it. Thank you.
Thank you, ma'am. Hi, guys. How are you all doing? I just have a few questions from radio, which I don't even have completely. I'll share my screen and we'll discuss. I hope you had a good exam. A lot of it was covered in Ortho by Apur sir. So let's go to share my screen. So this was the first question on uretrocele. It was an exact repeat of last FMG exam. Same image, everything same. So this, I think everybody would have gotten correct. So this is uretrocele, adder head appearance, right? I think the other options here, I don't think anybody saw the other options, so it doesn't matter. So this was uretrocele. Obs-gynae radio integration, there was an image on H-mole, was it? The snowstorm appearance, cluster of grapes appearance. So this is molar pregnancy. Complete mole versus partial mole, I don't think it was tested, but if you see fetal parts, it's partial mole, otherwise it's complete mole. Was this there? Yeah, cobra head. Cobra head would be the answer. Adder is the same as cobra, right? So adder head नहीं था, cobra head था, that would be the answer. अच्छा, sign पूछा था, diagnosis नहीं पूछा था. ठीक है. Previously they had asked the diagnosis. Okay, great. They changed the question. So this is uretrocele. Okay, flower vase sign कहाँ मिलता है बताओ? Flower vase sign is where you will see shaking hand calluses, same thing, horseshoe kidney, right? So that's flower vase or shaking hand. That's horseshoe kidney, not this. Okay. So yes, snowstorm, complete mole. Fine. This was there. ठीक है, good. Yeah. Next, LINAC पूछा था, linear accelerator. Did they ask what it produces? So LINAC makes two things. It's the most commonly used device nowadays because we use X-rays for radiotherapy. So it makes both X-rays and electrons. The concept is it's the same thing as an X-ray tube, जहाँ से electrons बन रहे हैं, and then they reach the target and they generate X-rays. Okay, so that is what LINAC, linear accelerator. LINAC stands for linear accelerator, something we've discussed in radiotherapy. Yeah. Does that make sense? PCOD, string of pearls was there. Was that a different question? Or are you confusing that with molar pregnancy? वो अलग क्वेश्चन था, मतलब ये यूट्रस है, वो ओवरी है, या ऑप्शन में लिखा था? Okay, maybe a different question. Coming back to linear accelerator, that's what X-ray. Yeah, so that is what the question was, I guess. Gamma rays are made in the nuclear reactor. Okay, ठीक है. Yeah, so PCOD wala I have not included. I can include it. Then 18 FDG PET. They're very, very fond of it. Last exam, they had 3 questions on this alone. Is bar kya tha? What was the question on FDG PET? I think a lot of radio gynae overlap apparently. 18 FDG PET क्या यही पूछा? What is the compound? So it's 18 fluoride deoxyglucose. That's 18 fluoride. Last time they had asked 18 fluoride is the positron emitter. So it's positron emission tomography. Yeah. ठीक है. Mechanism of X-ray पूछा था. Mechanism of LINAC पूछा था. Mechanism of linear accelerator is it makes X-rays. The mechanism of X-rays, it will go and damage the tumor cells. How X-rays act is double-stranded DNA damage. I don't think they asked that. It causes double-stranded DNA damage and it attacks the cancer cells through free radical damage. That is the mechanism of X-ray, if it was asked. Yeah. So 2 more questions you guys are saying. One is on PCOS. String of pearls appearance, where you will see the ovary with these peripheral follicles. Okay. Another OBGYN you are saying is twin peak sign, lambda sign, which is DCDA, right? So you will see that there are 2 babies, right? And the intertwin membrane is thick and it bifurcates, right? To attach into the placenta. So this is what you see in DCDA, whereas if it is a monochorionic diamniotic twin, it will be perpendicular insertion, thin membrane, like a T sign. ठीक है? So this also is simple. और बताओ. How are X-rays produced was also asked. Okay, so that is new. Every time they're asking some extra physics question. I remember last time they'd asked the definition of electron voltage. So they asked about Compton effect. Was photoelectric effect also there? So then the answer becomes photoelectric effect. Compton, this is a difficult question. Something that we teach to residents. I don't teach this to NEET PG for INICT students as well. Compton effect is Compton scatter. This produces scatter radiation. Photoelectric effect था क्या ऑप्शन में? फोटोन प्रोडक्शन नहीं होगा, एक्सरे प्रोडक्शन होगा. फोटोन नहीं प्रोड्यूस करते, एक्सरेज प्रोड्यूस करते हैं, है ना? So did they ask this? Yeah. So photoelectric effect would be the answer. X-rays maybe ये photon जैसा लग रहा था आपको. So X-rays are produced by the photoelectric effect. When they reach the target atom, they attack the electrons and they release X-rays. Okay. So answer would be photoelectric effect. Not expected. This one, every time there's one question on random physics which they'll put up. Last time they'd asked electron voltage. This time they've asked this. ओके, ठीक है. और बताओ. लीनियर एक्सरे ने, देखो वर्ड्स ही मिक्स कर रहे हो. दैट्स लीनियर एक्सेलरेटर डियर, दैट वी डिस्कस्ड. लीनियर एक्सेलरेटर विल जनरेट एक्सरेस. या इसी में पेयर प्रोडक्शन होगा. ओ आई हैव वन मोर. सो दिस इज पेयर प्रोडक्शन वुड बी वन मोर ऑप्शन, राइट? सो दीज आर द डिफरेंट एक्सरे इंटरैक्शंस विथ मैटर. सो फोटो इलेक्ट्रिक इफेक्ट इज योर आंसर हियर. ये एक और था. Somebody said there's a child playing on ground and then one foreign body came. So I don't know what the question stem was, but I think easy. When you see the full face, it is on the ESO. That's how we remember esophagus, right? But if you see on the frontal view a slit, that means it's in the airway, trachea. Okay, fibromuscular dysplasia. Did you see the string of pearls appearance? Let me show you. That's a nice question. यही photo आई होगी. I'll show you the exact one. This one. This is what they keep asking all the time. Was this the image? I'll just add it. So this is renal artery stenosis. Renal artery stenosis के दो causes होते हैं. Medicine में भी पढ़ा होगा ये. One is atherosclerosis, which is more proximal, and then this is more distal in young females, where they have this string of pearls. Did they show you this DSA? So this is what is fibromuscular dysplasia. Young female thi. Yeah, very typical. So if you see an older patient with renal artery stenosis, think atherosclerosis. That's proximal narrowing. If you see distal matlab away from the origin, right? When you see this string of pearls, string of beads, one more string of beads. So you had two string of pearls in the same exam. This is fibromuscular dysplasia. Yeah. Atherosclerosis भी option में था. Yeah. So history से भी बता सकते थे young female with hypertension. Anything else? Apparently, a lot of overlap from medicine, obs gynae. Pan भी DD था in polyarthritis nodosa. What we see again, this is not FMG level at all. This is a difficult question. You see microaneurysms. Okay, so you are gonna see these tiny microaneurysms in the distal arteries. That's how pan looks. So you should be aware for future exams what pan polyarthritis nodosa looks like. Diverticulum mir matlab Meckel's diverticulum, Zenker's diverticulum. Child had difficulty in feeding and drooling. Where's the foreign body? Okay, yeah. So esophagus. Okay. What is the diverticulum question? Come on, fast. Anything else? I think that's it for radio then. That's it. Keratoconus ka treatment, Gaurav sir will discuss. Okay, right. So that's it. I think Zenker's diverticulum was asked. Zenker's is it in between which layers? Okay, so again, not radio, but it'll be the two layers of the inferior constrictor. So cricopharyngeus and thyropharyngeus, right? So maybe that was the question. All right. Okay, Zenker's ka MR to nahi diya. We never do MR for Zenker's. They would have given barium, guys. MRI Zenker's का कैसे दिया? Nobody does MRI for Zenker's. How did they find that image? ये आई होगी ना, ऐसी फोटो आती है. Barium is done for Zenker's. Yeah? है ना? ठीक है. Good. Okay. Fine, guys. All right. So I hope that all of you passed the exam. Since you are up after the exam trying to see the answers, that just shows, how important this is for you. If I was in your place, I would have slept by now. But I am very, very excited to see that you guys are here and wishing you all the very best from our entire team. May you all clear the exam with flying colors. Thank you so much. We have Shrikant sir next. It for radio then.
Thank you so much, ma'am. Hello, dear students. Please inform me that everything is okay. Comment at the chat box. Can we proceed? Hope audio video everything is okay. Okay, so dear students, we are starting the session. So this time, I think anatomy was more to the easy to moderate side. Okay, it is. I can say that it was moderate. Few students are saying moderate. Nobody is saying difficult. We prepared very nicely. So hope you did very nicely. So the questions which I collected from the student side. Yes, there was the question. Main anatomy question. Yes, Johan. Please inform me that everything is okay. Okay. Yes. यस जोकर आ गया, एनाटॉमी का जोकर। यस डियर, आई एम जोकर। व्हाई? क्योंकि बेटा मेडिकल साइंस में ऐसे ही बहुत ज्यादा स्ट्रेस है, सो आई एम हैप्पी दैट आई एम द जोकर ऑफ द एनाटॉमी। आप मेरे नाम पे हंसते हैं, आप मेरे नाम पे मुस्कुराते हैं, और स्पेशली एनाटॉमी के नाम पे अगर आपकी दिलों में मुस्कुराहट आ जाती है तो इससे बड़ी ज्यादा उपलब्धि मेरे लिए, एक टीचर के लिए और कोई नहीं है। यस, थैंक यू डियर। So let's start. So during the our class, we dance very well. What? CSF, THP, MPM, VOT. So beautifully we dance at this time. So there was the question, sir. Just identify, just recall that late night classes. CSF, yes, THP, MPM, and then VOT. C for corpus callosum. Yes, S for septum pellucidum. F for fornix. T for thalamus. H for hypothalamus. P for yes pituitary, midbrain, pons medulla. Do you remember? तो ये फॉर्मूला हमारा काम आया? अगर काम आया हो तो एक बार दिल उड़ा दो। Yes, 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 yes. Dear students, hope you got the point. Yes, can you tell me the options were the same or not? Can you correct me with the options? Okay, fine. ओके सर, सो नाउ सेम ऑप्शन। ओके, कोई बता सकता है बेटा डी ऑप्शन क्या था? व्हाट वाज द डी ऑप्शन? ओके, वर्निकेज एफेजिया। थैंक यू निवेदी। Yes, thank you for the emojis. Okay, so now we are moving for the next. Identify the artery. So during our classes, yes, we did the very beautiful three-dimensional orientation. Lal full, Neela full, anatomy beautiful. Yes, anatomy is very dry, hard, boring, and volatile subject, and it is always one little try from my side, so that I can make the anatomy interesting. So the students who are joining for the first time to me, yes, please join the all the digital classes. आप anatomy के नाम पे मुस्कुरा न दें और ये चीजें डायलॉग के साथ आपको याद ना आ जाए तो बिल्कुल मेरा नाम आप बदल सकते हो. So at that time I had shown you the beautiful three-dimensional anatomy and we had seen each and every anatomy. So this time students are saying this artery, entry interventricular artery was asked, and even one beautiful insta post we did, लाडा लेफ्ट एंट्री डिसेंडिंग आर्टरी. तो वो इंस्टा का पोस्ट याद आया? यस, द सेम आर्टरी. आई टोल्ड यू बिफोर द सेशन दैट वन क्वेश्चन श्योर फ्रॉम द कोरोनरी सर्कुलेशन बिकॉज ऑफ द एंजाइना एंड द एमआई, दे आर द मोस्ट कॉमन कॉज ऑफ द डेथ इन द वर्ल्ड. एग्री? यस. Okay, option D was the globus pallidum. Okay, thank you. Thank you, Harmish. Globus pallidus. Thank you for your answer. Option was left. Okay, left marginal. Okay, so right marginal. I am including the left marginal also. यस, प्रणय. तो प्रणय ने बहुत बढ़िया हमको बताया. हमने जो क्लास के समय में मिडिल फिंगर दिखाया था और हमने कहा था कि नेशनल बोर्ड ऑफ एग्जाम को 3 बार अगर आप मिडिल फिंगर दिखाओगे तो वो आपको सर्टिफिकेट ऑफ रजिस्ट्रेशन देगा. यस, और मिडिल फिंगर के ऊपर क्वेश्चन आया हमारा डॉर्सल इंट्रोशेक, और ये मुझे बताया प्रणय गेडिया ने. अभी अभी मेरी फोन पर बात हुई. सो थैंक यू प्रणय. और जब हम इस मिडिल फिंगर के टॉपिक को पढ़े तो याद था, यस, घर में आग लग गई थी, लेकिन घर में आग लगने के बावजूद हमने नॉट भी पढ़ी थी. एनी इंप्रूवमेंट इन दिस क्वेश्चन? Okay, PYQ session. Okay, Aksi, thank you, beta. Okay, so we are moving for the next. Ansa cervicalis. So do you remember we told the second law, sir? Second Escavian law. Yes, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. सर, we studied ansa cervicalis is downside in the neck, but the thyroid is upside. So with the beautiful three-dimensional orientation, we had seen this all the muscles. So just look here. Sir, we had seen this all. Sir, platysma and sternocleidomastoid we removed, and we had seen the omohyoid muscle, we had seen the sternohyoid muscle, we had seen the sternothyroid muscle, and this is the thyroid muscle. Thyroid muscle is above, and the ansa cervicalis is here downside. Ansa means loop, cervicalis means is neck. So how it can supply the above muscle? This thyroid is directly supplied by, it is directly supplied by C1, but these all are supplied by the ansa cervicalis. Do you remember ansa means loop and cervicalis means neck? Are you getting the point? Yes. Okay, yes, Darji, thank you, beta. Thank you for your positive words. Any doubt? Any changes in this question, beta? Any changes in this question? ओके, पाइवा नहीं था ऑप्शन में, सो कैन वी रिमूव दिस पाइवा? ओके, थैंक यू बेटा. थैंक यू सैयद. नेक्स्ट, Sir, there was the question, I told you one question sure from this part. So we had seen that one formula, do you remember? Sir, there was the humerus, and I told you the formula A R M. A for, yes, axillary nerve, R for radial nerve, M for medial nerve, and behind the medial epicondyle, sir, there is the ulnar nerve. Are you getting? So students, we are saying that image was over the surgical neck of the humerus. Is it okay? Same image? Okay. Yes, Dr. Indu, thank you. अच्छा, image था यांचा वाला. Okay, sir. So we will include the image, beta. Any more update? How we identify facial nerve? Okay. How we identify facial nerve? Surgery. Okay. Okay. So can we move next? So look here. So the formula, the dialogue is the arm. Arm was the formula, ARM. Okay. Next. Look here. Sir, this was the question. So Pranay told me, sir, during the class, I told you, sir, this middle finger, 3 questions about the middle finger I told you. So what we had seen, middle finger, it is having the 2 dorsal interossei because the 2 dorsal interossei were attached. Okay, middle finger was having the 2 dorsal interossei. So this was the question over the dorsal interossei. Dorsal interossei, how you can identify? Sir, these are bipinnate muscle. Yes, these are supplied by the ulnar nerve, and the formula is the DAB. Dorsal interossei are abductor. So according to it, dorsal interossei are abduction. Any correction in question, image, or option? Please tell me, dear students. Lumbricals was given. Okay. But lumbricals are having the pain holding position. Otherwise, Babaji ka thullu position. Do you remember? Flexion at the metacarpophalangeal. Yes, extension at the interphalangeal. But this dorsal interossei, where muscle goes, their movement flows. So they will cause abduction. Okay. Can we move for the next? Yes. Any correction, please inform me. So there was the one question, a patient visited to the OPD with numbness near the mandible. Which nerve is involved in this patient? So I'm not getting the exact question, exact answer. Few students are saying half of the mandible was given and the marking over the mandibular foramen. यही था. Yes, diaphragmatic hernia का question था. Okay, very good. Lumbricals was given. Okay. So during the session, yes, we had seen these things, and with the 3-dimensional orientation, I told you, sir, the course of the nerve also. Okay. So at that time, sir, this is the inferior alveolar nerve which is running within the mandible. Yes, it is running within the mandible. So can you see, can you tell me what was the option? According to it, we have to change the answer. So here is the inferior alveolar nerve. If mandible was given and the mandibular foramen was shown, so this is the inferior alveolar nerve. This inferior alveolar nerve is supplying the lower jaw and it is coming out as the mental nerve. As the mental, same. Okay, Anjali, hope you all are getting the point. So according to it, inferior alveolar nerve was the answer, na? If any correction, please inform me at the chat box, better. Tumor जैसा कुछ mandible. Okay. I don't know it was the question of the anatomy or what, but we are proceeding. Okay, next. Labeling of the coracoid sternoclavicular joint and the acromioclavicular joint. So there was the any X-ray or cadaveric image. I am not getting, but just see here. During the regular classes, we had seen the shoulder joint part. So acromistop. So can you see this is the acromistop? Sir, this is the clavicle. So the joint between the clavicle and the acromion process is the, yes, you can say acromioclavicular joint. So this is the acromion process. This is the acromioclavicular joint, and here is the crow-beak like process. कौवे की चोंच की तरह जो मुड़ा हुआ नजर आएगा, sir, that it is a coracoid process. Getting the point? Yes, this is the R. Yes, you can say glenohumeral joint. Lingual nerve was there. Where in this question? Lingual nerve. Okay, so I'm mentioning the lingual nerve. Is it okay, Bala? Okay, fine. Okay, so here the X-ray was given. So you are saying X-ray was given. I'm labeling here, sir. This is the acromion process, sir. This is the clavicle, and it is the coracoid process. Okay, I will replace this image with the X-ray. Okay. Yes. Now we are moving for the next. Posterior dislocation of the hip. That is a car dash injury. I think it will go to the your orthopedics. So posterior dislocation of the hip. It is very common condition. Okay. And in this condition, FADER. Yes. So there is the flexion, adduction, and external rotation. And in this condition, sciatic nerve was injured. So you will see better in the orthopedics. Na? Yes, fracture of the humeral epicondyle. Can you tell me better? Such kind of question was there or not? Auriculo and masseter was option in jaw image. Okay. So you are saying auriculotemporal nerve and masseteric nerve. Okay, so I will remove this mental nerve. I will remove this great auricular nerve and include the auriculotemporal nerve and masseteric nerve. Okay, so very nice questions from the your anatomy, and hope you all did. We during our regular classes we did this all the things with the beautiful dialogues ना. तो बच्चे बता रहे थे कि सर आपके डायलॉग याद आ रहे थे, और सर सिलेक्शन हुआ तो हम तो चिल्ला चिल्ला करके माँ की कसम खा के बोलते जहाँ बोलोगे वहां चिल्ला चिल्ला करके डायलॉग बोलेंगे, तो सेरिबेलम में हम बोलेंगे। ओके, चलो बहुत अच्छा बना है बेटा हमारा एनाटॉमी का पेपर। ओके, सो आई एम गेटिंग द वेरी गुड ऑप्शंस हियर, द AIN and PIN in which question? Okay, fracture of the humerus epicondyle. So I'm not getting exactly. If they are asking the medial epicondyle, then ulnar nerve will be the answer. If they will ask the supracondylar area, then median nerve will be the answer. Okay, medial or lateral side, not humerus. Okay. So there was the, you can say, fracture of supracondylar area. Okay, so median nerve will be the answer, but if it is not given, then AIN will be the answer. AIN will be the answer. Okay, so I am replacing this question, fracture of the humeral epicondyle. It was not given, sir, but fracture of the supracondylar region, and it was the IBQ. Okay, I will replace X-ray. Okay, X-ray was given. Tingling and numbness. Okay, sir. Tingling and numbness. So definitely it will be on lateral 3.5 side. Okay, thank you Disha, thank you beta, thank you. Okay sir, now डायग्राम में मीडियल इपिकॉन्डाइल था, चलो इसको हम देखेंगे और डिस्कस करेंगे। यस, again I told you yesterday that one question sure from the diaphragm and diaphragmatic opening. So yes, during the class we created one very beautiful concept with the proper three-dimensional anatomy. We had seen the diaphragm and there are three opening, sir, vena cava opening, esophageal opening, and the aortic opening. Okay, so diaphragm is piercing the, yes, diaphragm is pierced by the esophagus. So do you remember, sir, here was the cricopharyngeal junction at C6, sir, they there is the cricopharyngeal junction at the C6 here, cricopharyngeal junction, you can say C6. There is the arch of aorta at the T4, arch of aorta. Yes, T6, there is the left bronchus. This question was asked last time, and here is the our diaphragm at the T10. So formula 4 plus 6 is equal to 10. So answer was the yes, the opening of the diaphragm. Is it okay? Done? Okay, 40 centimeter. Yes, 40 centimeter, at 40 centimeter. So we had seen now what, 15 centimeter, 22.5 centimeter, 27.5 centimeter, and the 40 centimeter. Sir, cricopharyngeal junction, here is the left bronchus, here is the arch of aorta, and here is the our diaphragm. Better to remember 37.5 centimeter, but you can take the 40 centimeter. Okay, fracture in the neck of the humerus. Yes, we discussed that point. Huh? Okay, 40 centimeter was given. Okay, we included the 40 centimeter. Okay, so 40 centimeter opening of the diaphragm. Okay, now next, varicose vein. So this was the again previous question, surgery question, anatomy question. I'm not getting the exact format, but varicose vein case, and answer was the great saphenous vein. Great saphenous vein. Can you tell me the question and the options? Yes, dear students, questions and the options. Okay, same. Okay, fine. Now Yes, this is our pediatrics anatomy and the medicine question. This was the boot shaped heart. Yes, I taught you that there is a truncus arteriosus. The spiral septa is developing into the two equal part, aortic valve and the pulmonary valve. But if there is a problem in the development in that situation, sir, there is the displacement of this septa. So here you can observe there is the overriding of the aorta. एओर्टा जो है पल्मोनरी वॉल के ऊपर चढ़ गया सर दिस नैरोइंग ऑफ द पल्मोनरी वॉल सो दिस पल्मोनरी स्टेनोसिस so due to the pulmonary stenosis there is the increased pressure on the right side of the heart so that is leading to the right ventricular hypertrophy and the blood is going from the right side to the left side means it is classical example of the right to left shunt so this is going from the right to the left through the ventricular septal defect. So we did this all the things during the class. So these four things 1, 2, 3, 4 known as the tetralogy of the phalloid. And if you will add in more severity HD, that is the pentalogy of the phalloid. And if you will remove this HD, then it will be known as the trilogy of the phalloid. Hope you cracked this question. Yes. Near medial malus. Short saphenous vein. Okay. So I am including the short saphenous vein. I am including the near medial malleolus. I was flying after that picture popped up. Very good, Niveti. Okay, fine. Tibial vein also. Okay, popliteal vein also. No? Okay, fine. Any correction, please. Yes. So this was the one question. Identify the order of the muscles from medial to the lateral side. Okay. So there is a diaphragm. Can you observe here, sir? The muscles on the posterior side, you can remember, sir, this is the psoas major and this is the psoas minor. And then this is the quadrangular muscle. So this is the quadratus lumborum. And then this muscle is running transversally. So this is the transversus abdominis. Actually, here is the location of the kidney. So, yes, first MBBS question. I am teaching this one for the first MBBS student. So, position of the kidney. Answer is the doctor prescribed quinine tablet. D for diaphragm. P for psoas major. Q for quadratus lumborum and T for transversus abdominis muscle. So the students who studied with me in first MBBS, they can get this topic, na? Yes, it is a postulation of the kidney. So you can see the sequence. Psoas major is medially, then quadratus lumborum, then transversus abdominis. Yes, the brother of the psoas major, this is psoas minor. So psoas major, then psoas minor, then quadratus lumborum, then transversus abdominis. So your sequence is the psoas major, psoas minor, quadratus lumborum, and transversus abdominis from medial to lateral. It is surgery relation. It is the posterior surface of the kidney. Yes, very good, very good. You got correct by just by the imaging. Yes, विष्णु बहुत बढ़िया बेटा. वैसे भी मैंने कहा है कि इमेजिनेशन पावर जो है बॉयज में बहुत स्ट्रांग होती है. यस, लड़कों इस पावर का सदुपयोग करो, दुरुपयोग मत करो. बहुत बढ़िया विष्णु. Hemimandibulectomy, which pterygoid causes deviation to the other side? Okay. ऐसा कोई क्वेश्चन था? Which pterygoid causes? Okay, I'm writing, na? I'm writing. There was the case hemimandibulectomy. Pterygoid causes deviation to other side. Actually, what happens, sir? One side medial pterygoid and other side lateral pterygoid, they act together and they deviate the mandibule from one side to the other side. So we have to look for the option for the such kind of the question. Please inform me what were the option. बहुत बढ़िया जॉर्जिया रियल एनाटॉमी का मैजिक लगा के आपने सॉल्व कर दिया. बहुत बढ़िया. 40 सेंटीमीटर ओपनिंग, दैट इज द इसोफेजियल ओपनिंग. Yes, which of the following is formed by the structure? So there was the question for the tracheostomy. So this is the question of the ENT also. So tracheostomy is done, yes, between the second and third ring. Na? So this was the question. So more questions were there. Please inform me if you will integrate. Many questions are there, and also we did the microanalysis session for all of you. So for this microanalysis, most of the questions from the PYQs and PYTs. Hope that session was also useful for all of you. So thank you very much. If any update, if any changes, please inform me at 91317 83495. Yes, and don't forget to follow me at Insta and the YouTube channel also. So thank you very much. God bless you all. So this is the time for the next teacher. Thank you so much.
Hi, sir. Thank you very much. Hi, everyone. I hope all of you had a good paper. And I think Obs and Gynae was quite all right. Let me just share my screen and then we can start. Okay. So just a second. All right. So what we do is, I wanted to just add on some questions have been done like the radiology one, so I won't spend too much time on those. Let's start. So there was a question from primary amenorrhea. I don't know the age of the girl, but the questions that were given, the scenario that was given was that breast was well developed, Tanner stage 4. There was no uterus and no ovary. That's the clue. No ovary means that the gonad is probably, so it's probably 46XY, and testosterone levels were normal male level. So then this is amongst the two. I don't know the other options, but when there is breast development with no uterus, you think of two things, MRKH or AIS. How do you differentiate based on karyotype or based on the gonad that is given? So if there's no ovary, it is complete AIS. Too many questions from OBG. That's very good, I think, in my opinion, because I think most of them, I think 95% were very doable. Okay, so she was a 14-year-old girl, all right. Okay. Okay, all right, fine. So then this was quite doable. Next question, a question this has been covered in radiology. I think two questions came from molar pregnancy. One was the image-based question on snowstorm appearance, where beta HCG was very high. I think the value was given more than 1 lakh. Correct me if I'm wrong. Okay, and apart from that, there was the image given the snowstorm classical. So this was complete mole. So then, okay, in the earlier question, there was scanty pubic and axillary hair. Fine. That is, of course, AIS then. Okay, so what else was given in this question, and what was the other question on molar pregnancy? I think the other question on molar pregnancy, okay, this was 5 lakh. The other question was, I think, the treatment. So there were two questions, correct me if I'm wrong. One was the image and one was the treatment, where the correct answer, of course, is suction and evacuation. If there's anything, any other options, just fill me in. So what else? Probably one would have been methotrexate, I'm sure. Okay, I'll just add here scanty, pubic, and axillary hair. So I remember for the future. Suction curettage. Okay. Anything else was given in the option? Do let me know. I will check the messages later. This, of course, is the correct answer. Grape-like vesicles. Grape-like vesicles were seen here. Okay. DNC was given. Yeah, so there were two questions on molar pregnancy. So I think just fill me in. I'll keep checking the chat box. We'll move on. So two easy questions from molar. Molar is a very high yield area. This has been covered in under radiology. This is the string of pearls. There was a young girl with irregular cycles with ultrasound showing the typical string of pearls appearance. If you could just fill me in and the other options, then we can move along. Methotrexate we don't use in molar pregnancy. Methotrexate we use in choriocarcinoma. Molar pregnancy always is suction evacuation followed by beta HCG surveillance. There is a 15 to 20% chance she may develop choriocarcinoma. Choriocarcinoma, the treatment of choice is chemotherapy, that is methotrexate. Okay. So grape-like vessels was a different question. So that's what, there are two questions and there's a lot of confusion what was what, but I think both the answers are pretty clear. Okay. Now, this was an important question, so I'll just spend 2 minutes, and this has been discussed in the classes when I discuss management of twin pregnancy. I always show this, and I always show this image, and I always tell that what is this? This maneuver is called internal podalic reversion plus total breech extraction. And the only which is transverse lie, and where an ECV or an EPV has failed. So pediatrics in today's day and age, first of all, is done always under general anesthesia. It's done in the second of twin with transverse lie. So if the second of twin is transverse lie, the first has delivered, the second is transverse lie. The first thing you try is ECV, external cephalic version, or external podalic version. But if these fail, then remember that clock is ticking. You don't have much time. Shift to OT. And under anesthesia, either do an IPV plus a total breech extraction, that is, grab the feet of the baby, turn the feet towards you, take the baby out. It sounds very easy. It's extremely difficult to do. Or you do a emergency cesarean section. So this is a question which has been asked for the first time, but I always teach this very important image-based question. Okay. The other option was, okay, okay. So yeah, lambda sign we will cover. I've got that question also. There's another question, right? I'm coming to that also. Okay, so this was delivery of a non-cephalic. It's actually a twin in the transverse lie. So a better answer if this was the option, delivery of transverse lie, second twin. Okay. Okay, we'll go one by one. Questions. I know you're writing the questions. There's a question on polyp with feeding vessel. I don't have that. I will add that. Okay. Okay, so this is a very commonly asked. This is asked in every exam. This is straight away Chadwick sign, blue issue of the cervix and the vagina on examination seen in early pregnancy. So I'm not going to spend time here. Next question was a patient who has a LNG IUS for contraception, and she presents with irregular bleeding and asks for it to be removed. Right. So, but this was the question, or demands for it to be removed. Someone told me, what is the next best step? Should you remove it? Should you not remove it? Remember, one of the known complications of, well, I am moving fast. Don't worry, Pranay, I'm moving fast. One of the known complications of LNG IUS, especially progesterone contraceptives, is irregular bleeding spotting. So all we have to do is reassure the patient. Most of them will become amenorrheic by the end of 1 year. Okay, so the other question options, just fill me in and I will see from the chat box. Okay, the next question was a question. Just correct me because I'm getting a lot of mixed reviews here. There was a question, a scenario was given on recurrent pregnancy loss in the second trimester with the ultrasound. There's an image with the cervical length shown. Somebody was telling me it was the placenta, but I think it was the cervical length which was shown. And what do we do here? What are we going to do here? The treatment, if the treatment was asked, I don't know what was asked, the treatment, she's a perfect candidate for doing a cervical cerclage. Recurrent pregnancy losses, especially in the second trimester with a short cervix, you're going to do a cerclage. Anything else from here? Please tell me. Yeah, that stool wala question we will come to, don't worry. So yeah, so the question or the diagnosis was asked, not the management. So this is cervical insufficiency. Okay, so cervical insufficiency or incompetence. So the management was not asked, the diagnosis was asked. Fine. If the patient wants to remove, it's your job, but you to explain to her, to reassure her, because this is a known complication. In fact, before putting the MENA, we always tell them, expect irregular bleeding for up till a year. Okay, which of the following is a contraindication to methotrexate for unruptured ectopic pregnancy? And this is the correct answer. If cardiac activity is there, we never give methotrexate. And the other options, I think beta HCG, I need to know the value. And what were the other options? Was the size mentioned? And I think primi gravida was mentioned. So what are the other contraindications? Beta HCG, remember, we give it, if it's more than 5,000, we will give methotrexate. Less than 5,000, we will not give. Okay. And anything else? Let me know, fill me in here. There's a bit of lag, that's why I'm just waiting for the answers to come on the live, and that's why it's taking a bit of time. 2200 beta HCG. Okay, 5 centimeters. What was mentioned? 5 centimeters, 3 centimeters, because more than 3.5 we will operate, right? Okay. All right. It must have been 3, 2004, 2200, anything less than 5,000. Okay. And the fourth option, someone told me primi gravida. I'm not sure. But that is an easy question. Again, a very easy question. High blood pressure, which contraceptive will you not give? You will not, especially uncontrolled high blood pressure, you will never give an estrogen containing contraceptive. Very easy question. We will move on from this. The next question was a question on tubal sterilization. What is the best permanent sterilization method for a woman who doesn't want to have more kids? And the other options were quite weird. It was quite obvious that the answer is modified pomeroys. This is what the government of India wants or advises. The other options, I think, were salpingectomy, salpingotomy, partial salpingectomy. I think that was there. So remember, if when do you do a salpingectomy for tubal ligation? If the patient has a failed pomeroys, that means you've done a pomeroys and then she conceives and she's like, I want an MTP now, your procedure failed. What do you do now? So you do the MTP and you will do now a salpingectomy or a partial salpingectomy because you don't want another failure to happen, right? So this is a modified pomeroys. Okay. So this was what we do. Okay, right, all right. Next question, another question which is preconceptional patient is diabetic and her HbA1c is 8.5 and she's on insulin. She wants to get pregnant. What are you going to do? All right, so remember you have to optimize the HbA1c. You have to bring it less than 6 because I've told you this, the higher the HbA1c at conception, the higher the risk of congenital anomalies. Right. In fact, with a HbA1c of 12, there is a 25% risk of anomalies. So you want to bring her sugars down. Okay. So you have to reduce her HbA1c, or I think one option was increase her insulin. Okay. Reduce the HbA1c level, and then she has to conceive. What are the other options? One was start folic acid after conception. So actually, the best answer here would be start folic acid also. Reduce her HbA1c and start preconceptional folic acid, not folic acid after she conceives. You have to give her folic acid 3 months preconceptionally. All right, so this was an easy question again. Postmenopausal woman with a hot, flush, dry vagina. I think this was a question. I got again mixed options. Is this a question? Is this not a question? So please tell me if this was the question, then FSH and LH are going to be high. Okay, FSH and LH are going to be high and estrogen and progesterone are going to be low. Right, so if this was the question, let me know. I'm not too sure. I'll just wait for a minute because I'm not sure if this was a question. Yes, same question was there. All right, it's there. Fine. So this was quite easy. Again, postmenopausal estrogen will go down, progesterone go down. That's going to cause a positive feedback on FSH, LH. Then there was a question on late D cells. A few people told me they were variable, but majority said no, they were late. The dip was happening after the peak of the contraction, right? So if this is classically late deceleration, variable has no relation to the contraction and early has a very symmetrical correlation. Okay. Okay, then there was a question, two questions in labor. I got one, I'm not sure about the other, but let's discuss this. There was a patient in labor, ARM was done, and there is sudden fetal bradycardia. What is the likely diagnosis? I think in this question only head is 5 years palpable, or this was some other question. So sudden fetal bradycardia on doing an ARM is most likely to be, it could be abruption also, but abruption, they would have likely given bleeding happened. If there's bleeding present, it is more likely to be abruption. If there's no bleeding and the head is high, 5/5 means the head is high, almost floating, it's not entered. So there's a good likelihood that this is cord prolapse. Okay. Okay. All right. Okay, same image from the workbook came of variable deceleration. Okay, let me see what everyone else says. So that's what I'm saying. Some people are saying it was variable. Some people are saying it was 100% late deceleration. Okay, same question. This was there. All right. So what was option D? Option D, rupture. Uterine rupture is there. What was option D? Cord prolapse I have. All right. Okay. Then there was a question, there were two questions on gross post-hysterectomy uterine specimens. There was one question where there was a lot of confusion. Is it fibroid? Is it adenomyosis? But it was given a diffusely enlarged uterus was mentioned. I think they mentioned also that was 12-week size. Correct me again if I'm wrong. A Paris woman with heavy menstrual bleeding underwent a hysterectomy. This is the cut section of the uterus. It was a diffusely enlarged uterus. It is adenomyosis. Menorrhagia, heavy menstrual bleeding, plus dysmenorrhea, diffusely enlarged uterus. Okay, precipitate labor was there. Precipitate labor was there. Fine. Okay, so this is like, I don't know, that's what I'm saying. I think it's adenomyosis. Some were saying it's fibroid. I think there was a separate question on endometrial cancer also. Okay, so diffusely enlarged, fibroid will be there'll be a very well-defined whitish colored lesion. If that's not there, they will both present similarly, although adenomyosis is more likely in a Paris lady, fibroid is more likely in a nulliparous. 60 questions from OBG. I got only 30. Okay, let's continue. This is a INI repeat question. The same question came from INI November. If this is the same question, there's a pap smear which shows atypical glandular cells. Whenever glandular cells are there, you suspect an endocervical, that is glandular means columnar epithelium. So suspect an endocervical or an endometrial pathology. Endometrial cells might have dropped down from the endometrium. So always do not only a cervical biopsy, but also an endometrial biopsy whenever you have glandular cell abnormality, which are very rare. We mostly see squamous cell abnormalities. So if you see glandular cell abnormalities, you have to take an endocervical and an endometrial biopsy. Okay. Okay. Then there's a question, very easy question. Curdy white, vaginal discharge, pruritus, non-foul smelling. You will see pseudohyphae. This is nothing but candidiasis. What will you see? Pseudohyphae and budding yeast cells. Right. Okay, again, easy question. Anemia Mukt Bharat treatment. This is not prophylaxis. This is treatment of anemia. You give double the dose. Prophylaxis, we give one tablet of 60 milligram iron. This is, sorry, my typo, 500 microgram of folic acid twice a day. So you're going to double the dose. Once a day for prophylaxis, twice a day for treatment. I'm going fast, Vijay. This is, I think, quite fast. Okay, I'm only stopping on where I have some confusion. कि कोई question में doubt तो नहीं है. Clinical scenario on rectal endometriosis. There was a question whether the patient is bleeding, having cyclical bleeding per rectum. Whenever you have bleeding from anywhere in the body, which is happening only during periods, it is always endometriosis. This is rectal. She probably has a rectal nodule which is felt, or this is called as rectal endometriosis. Bleeding during periods. Some women have bladder endometriosis. They are going to have cyclical hematuria. Cyclical bleeding PR is endometriosis, nothing else. Okay, now this is a question which I'm a bit confused on this. You have to help me out. There's a patient in labor. What was her dilatation? I want to know. Okay, some are saying 6 centimeters, some are saying 4 centimeters, and the anterior fontanelle and posterior fontanelle both are palpable. When both are palpable, what does that mean? The head is deflexed. It is not flexed. In flexed head, you won't feel the anterior fontanelle. Only when the head is straight, like how I'm teaching you, anterior, posterior, you'll be able to feel both. So this is a deflexed head. Now, deflexed head kahan hota hai? Remember, deflection is always associated with occipito-posterior. Right? Occipito-posterior, you commonly see fully dilated or 6 centimeters, 6 centimeters dilated. All right. And I think the station was also given 0 station. Okay, so this is not face, this is not bro, where this is occipito-posterior is what I understand. Transverse, so deep transverse arrest was an option. If it was, remember DTA is defined when the cervix is fully dilated and the sagittal suture will be in the transverse diameter. Here it was given the oblique diameter. So this is more likely to be occipito posterior. All right, station at 0. Okay, fine. So station was 0 station, but 6 centimeters dilated. 8 hours से labor में थी, 8 hours labor. So going into prolonged labor, one of the causes is occipito-posterior. Postmenopausal bleeding with an ET of 8 millimeter, was this a question or was there an image that endometrial CA, was that the image? There was an image and this question, both only one question. So I think OBG was very interesting. A lot of different, I mean, a lot of PYTs, of course, but nicely in a different way they had asked. So, but it wasn't that difficult. It was a long question. I know all the questions are usually made long. This was the question. So you'll do an endometrial biopsy. Anything more than 5 mm, no image. Okay. Anything more than 5 mm, you will do a biopsy. This is a repeat question. This has been discussed. This is lambda sign, DCDA, not wasting time on this at all. A woman gives birth to a stillborn baby. What is given for lactation suppression? Again, easy question. Bromocriptine or cabergoline you're going to give for lactation suppression. Right. Now, was this a question? This is again, if this was the question, then this is again a previous NEET PG question. Someone told me there were two specimens of the uterus. One was adenomyosis, one was endometrial CA. There was some growth seen inside the uterine cavity. And if this was the image, the irregular growth seen in the cavity, then it is endometrial carcinoma. And someone was telling me there was a question on polyp with a single feeding vessel also, right? Was this the same question, and was it a polyp or was it endometrial cancer, or were they two separate questions? Okay, this was the question, endometrial cancer. So this is NEET PG, previous NEET PG repeat questions. You got questions from INI, from NEET PG, exact same to same repeat. Polyp alag tha fir? Polyp was separate? And this was one question I found. I think it was very interesting. Did this come? Just anyone tell me, did this actually come? Okay, so it was a separate question. Polyp was separate. Obese multipara with polyhydramnios कौन सा question था? Polyp was different, ठीक है. So in India, pregnant women do not eat which fruit because so papaya नहीं खाते. ऐसा नहीं है, मना है. क्यों नहीं खाते papaya? Because in olden days, like olden means really olden days, raw papaya, the seeds of raw papaya are known to be an abortifacient, है ना? तो वो अब ना it's gone all along. If you have a nice ripe papaya, nothing is gonna happen. But fear is so much now. Now even I say if the patient comes to me, ki nahin, it's okay, don't eat papaya. Nothing will happen for 3 months if you don't eat papaya, or 9 months also. Okay. So this is a PSM question. Okay, it's a gynae question also because this is commonly asked. All right. So I think that is what I have. I'll add the polyp question. Anything else? You all have my number or put on the chat box. Please let me know. And all the best for your result. I'm sure all of you have done really super well. And handing over to the next speaker. Thank you.
So hello everyone. Let's go through the physiology question quickly. I do not have the options of some questions, right? You can give me in the chat box. I'll definitely add them up. So first question, I was very happy that there were many, graphical questions came, and it was from our notes, right? So I hope you can see the slides. All right. So let's move on. This was the question, right? And I want to know there were two scenarios I got that ABCD was shown and they have asked which valve is going to open at this point, right? And I got another question like this, that X point was shown and they have asked what is going to happen. So let me know. Acha, ABCD option was given. All right, the options were ABCD and they have asked that aortic valve opens where. Okay, I'll change that. But you know that this point was shown and aortic valve is going to open at the right hand side uppermost point, right? Our mnemonic is going to work over there, ma'am Coco, right? Next question, the Rio based chronexia and utilization time. Usually this is not asked in the FMG, but it is again a repeat PYQ from the I9CT question banks, right? So see over here. First thing first, whenever you give a threshold stimulus, I told you the threshold stimulus is going to be called as a Rio base. So threshold stimulus will be called as a Rio base. So this is A is the threshold stimulus, right? Over here, the strength of the stimulus is given. So threshold stimulus is Rio base. Then they have asked this one, right? When you give threshold stimulus, the time required, the duration required to give the response is known as utilization time. Utilization time, mind you, it is not when I give double the Rio base. It is only when I give the threshold stimulus, it is known as utilization time. And when I increase the Rio base, that is double the Rio base stimulus is given, the time required is going to be chronexy. That is going to be there. Okay. Yes, I repeat question. Koi baat nahi. All right. So this was the question. I hope it is right. This is how it is given. Yes. Let me know that. Okay. Chal. Next. ये वाला question आया था ना. I hope that all the cerebellum students got it correct because the bridge is ready for you otherwise, right? I hope you got this correct. I told you whenever there is a head trauma and increase intracranial tension, there is a confusion between the heart rate and BP, but I told you heart rate is only going to increase in the vein bridge wala reflex, right? So that's why over here you have the bradycardia and hypertension. That is nothing but what? That is nothing but the Cushing's reflex, right? Confusion wala reflex, right? I hope this is correct, है ना? So जिसका भी हाँ जिसका भी wrong हुआ है, so let's go on the bridge, right? Let's leave you on the bridge. Next question. A typical pattern, ये तो हमने 1000 बार किया हुआ है. This has come in the marathon also. So crescendo, decrescendo pattern or diamonds are shown over here. So chain of the diamonds. I told you chain of the diamond is shown. Then it is chain stroke breathing or kind stroke breathing. All right. So that is going to be there. Okay. Fine. Right. So that is there. I hope that was correct. And one pregnant female was given with the iron deficiency anemia, and she is already taking the iron folic acid tablets. But for increased reabsorption, you say, or efficiency of the treatment, the clinician has given one more vitamin. The vitamin C is going to be the answer. Why? Because vitamin C increases. Yes. Vitamin C increases the iron reabsorption, right? This was the question. I hope it was there. Okay. Next. This was the question. I hope this is what I have got. Lowest sodium potassium conductance, where it is going to occur in the action potential ka point that they have shown. So I'm going to mark the hyperpolarization because they have asked lowest sodium potassium conductance. And I told you, if I take sodium is to potassium conductance, right, and I want it to be lowest, I want least sodium conductance. That means the sodium channel must be closed and the potassium is still going outside. Right, so it is going to be at 0.4. Why not at repolarization? Because in the repolarization the sodium is inactivated, they're not closed per se, right? So only potassium is going to go out, which is going to give this fourth point. So if I have to choose, I'm going to choose the fourth point, right? So that is going to be there. Okay. Ratio was asked, so you have to give me the ratio. कैसे पूछ सकते हैं यार? रेशियो में क्या पूछा था? लीस्ट रेशियो पूछा था. ठीक है, even all right. BCEF was the option. Neeraj, BCEF, ABCD was there in this options. 1, 2, 3, 4 के जगह ABCD होगा. Ratio was asked. Okay, चलो, I'll change this question. टिप पे था, क्या पूछा था? They have marked the spike potential. Is it like that? Okay, let me know what was the question. Geeta Gyan, please let me know whether they mark the spike potential and then they have asked. Okay, just give me the inputs. I'm definitely going to check the chat box. Okay. Next, botulinum toxin mechanism of action. This was the question which was asked. Conductance ratio is going to be highest. Okay. Highest value. Chalo, I'm taking the screenshot and whatever it is there, I'll just mark it up. All right. I'll change the question accordingly. Now, this was the question asked. Botulinum toxin, ये question था, right? Same graph दिया हुआ था. Okay. चलो, ठीक है. Where the potassium channel closes, it is going to be after the hyperpolarization. Chalo, ठीक है. Let's move on. Just give me the inputs. I'll definitely check the inputs afterwards. Presynaptic blockage, synaptobrevin is going to be attacked, right? And the acetylcholine ka exocytosis will be blocked. Okay. Pufferfish was mentioned where? It is Zaza 122, right? So pufferfish was mentioned where? In the question it was mentioned. Okay. Yes, tetrodotoxin. So options were correct. Option, they have asked the mechanism of action, right? Yes. What was the question exactly? Let me know the options, right? And the question. Chalo. Next question. Patient had a head injury, can talk fluently, but does not understand. I told you, well spoken is Wernicke's. Well spoken, बात अच्छे से कर रहा है, but does not understand means nonsense aphasia or sensory aphasia. One person told me that Wernicke's was given. One told me that area has been asked. Let me know which one was asked. Area was asked, or the aphasia ka naam, the name of the aphasia were asked. Which one was the correct scenario over here? Let me know whether the mechanism of action of what tetrodotoxin is mentioned. Okay, all right. Badly prepared pufferfish. All right, chalo. Okay, comparison of the toxins. Acha. Botulinum is going to attack the snare proteins, and tetrodotoxin is going to block the channel, right? All right, aphasia is asked. Chalo. So I'm going to cut this down. So aphasia was asked, not the areas, right? Chalo. Next. हाई एल्टीट्यूड पे माउंटेन सिकनेस हो रहा है नॉन स्पेसिफिक सिम्टम्स के साथ हेडेक नाउजिया डिजीनेस फटीग एंड हाइपोक्सिया SpO2 low SpO2 was mentioned. What is the best treatment? Given the scenario of acetazolamide, the best is going to be descent to the lower altitudes. I'm going to mark lower altitude is going to be the better one as compared to the acetazolamide. Let me know, somebody has told me that there was a question related to Laplace law. Was there any question related to Laplace law, and what were the options? Please let me know about it. Meaningless patient. Okay, done. Decrease heart rate, increase. The ICT question was done better. It was just done. All right. Next question. Pregnant female in the third trimester. I got to know that there were 3 to 4 questions are related to ABG, arterial blood gas analysis, right? But I haven't gotten this. Plasticity graph. All right. Plasticity ka kaun sa graph aaya tha beta? You're talking about the urinary bladder ka cystometrogram, right? Cystometrogram was given. Is it? Plasticity is due to. Okay, I'll just add there. Plasticity is due to. Okay, so this was also a graph-based question, right? Graph was given, yes? Or just they have asked that plasticity is due to? Let me know, okay? Chalo. Next, identify the mechanism. Pregnant female में third trimester में progesterone is going to be very, very high, which actually stimulates your respiratory centers. If the respiratory center is stimulated, of course, the hypoventilation is not going to occur, right? Hyperventilation is going to occur. And hyperventilation से क्या होता है? The CO2 is going to wash out. And that's why I'm going to choose the respiratory alkalosis. There is no problem in the kidneys per se. All right? Okay. Vishnu Prashant, kindly let me know if you know what are the, basis of those 4 ABG questions. Graph was given. Okay. Thank you, Pawan. I'll just add those graphs. Okay. So typical question of the cystometrogram, which we have discussed in the classes, right? Next question, I got to know that there was this acidosis was given, pH was low, and the exact value of PCO2 and bicarbonate I haven't gotten yet, right? But they told me, students told me that there were low PCO2 as well as a low bicarbonate. Bicarbonate is low, acidosis meeting the criteria, right? That means there's a problem in the metabolic system, right? And of course, I told you, always look at the pH first. So it is the case of acidosis, not alkalosis. So 2 options were out already. Metabolic acidosis because the bicarbonate is low. The PCO2 has been low, but the acid is lower, but pH is also lower. That means it is going contrast to the pH change, and that means it is compensating, right? So that is all I have gotten till now, right? And I'm taking the question. Transduction ka kya question tha beta? Transduction ka kya question tha? Let me know. Was it related to the receptors, somatosensory receptors? Is it CNS say Pacinian corpuscle, mesial corpuscle? Sneha, let me know, was it related to the somatosensory receptors? Three questions on the ABG. Third question, can you give me an idea that what kind of question has been asked? Paradox, Oxy paradox. Chalo, you give me the idea about it, right? Definitely what I'm going to do is I'm going to take your inputs and I'm going to make a proper PPT and we'll share it on the Cerebellum app, right? Till that time, I'll hand over to the next faculty. That is all from my side. Thank you very much. Keep adding the inputs. I'll definitely check later on.
Panini sir, if you are ready, we can start.
Yeah, can I start?
Yes, sir.
Okay. Well, just a second. Yeah, well, the paper was easy, I think, right? Am I visible? Right. Okay, fine. Sure. So there was a question on X-ray of your foreign body coil in the esophagus was given, I think. Okay. Can you see me now? So whenever you are seeing the face of the coin in a AP view, it is definitely in the esophagus, right? So the answer is the foreign body should be in the esophagus, right? Okay. A person was at a restaurant, food struck, and his friend is a doctor. Where will he make a cut for the person to breathe? Was this the same question? What were the options? Was this the question, exact question? Mallampati staging anesthesia madam will take care of. Yes. So if the foot has, okay, if there is a block in the upper part, you have to utilize the lower part. That's what I have been telling in the class. Okay. So, yeah. So immediately the accessible part wherever. So can't intubate, can't ventilate situations, you have to go for cricothyrotomy, right? Fine. If it was IBQ shown, image was shown, it could have been cricothyroidotomy only, right? So identify. This was the question there. So this was Rinke's edema. Am I fine? Tracheostomy option is there. And if the patient was in the hospital mentioned in the question, then you can go for tracheostomy. If the patient has already come to the emergency room, okay, then you can go for tracheostomy. Usually immediate airway access you can get immediately in the cricothyroidotomy only. Then after you go for permanent tracheostomy. Right? This was there. Rinke's edema was there, no? Yes, okay. Fine. And one more noise-induced hearing loss at 4000 hertz, a dip was given. So that was noise-induced hearing loss. He was a factory worker also, it was given in the question. Right? Am I fine? Hopefully. If any mistakes are there, please do correct me. You can personally message also. And there was a question on carcinoma larynx. Vocal cord was mobile. So vocal cord movement was not restricted, means it is not even T2. It is T1 and M0, M0. Then that should be stage 1. If vocal cord movement was restricted stage 2, T2, and fixed vocal cord T3. I told you this repeatedly, right? So in stage 1 and 2, it will be only radiotherapy. Nasopharyngeal cancers and laryngeal cancers are highly radiosensitive, right? Treatment is radiotherapy. Rini positive in both ears. Weber lateralized to left side, which is affected. So Weber lateralizing towards affected side, but here the catch point is Rini is positive. If Weber lateralizing towards the left side, so what could be what you will think it is as Weber is confirming it as left conductive hearing loss, right? Okay. Was this the question or any other additions and modifications are there in this question? This line tells that left Weber lateralizing towards left side affected, and affected side is also left side, means it should be conductive hearing loss. If it is very, very mild conductive hearing loss, sometimes you may get Rini positive only. Okay. So this should be left conductive hearing loss only, right? Fine. Okay. Identify the pure tone audiogram. Both sides, right side, red for right, RR I told you, and left side blue, right? So both sides you have gap, airborne gap was there, bone conduction was normal, air conduction was affected. It should be bilateral conductive hearing loss, right? So straightforward, very easy questions were there. Voice change after thyroid surgery. Patient cannot sing high pitch note. Means that tensor action is lost. So who is tensing the vocal cords? Cricothyroid. Who is supplying the cricothyroid? EBSLN, external branch of SLN, right? Am I right? Okay, fine. Right. And facial nerve identification in the parotid region. If in the parotid region the question was asked, then it should be tragal pointer. So 1 centimeter deep to the tragal pointer cartilage, you will find the facial nerve deep inside. Right, just 1 centimeter near to the tracheal pointer, you will find the facial nerve. If it is in the neck anterior triangle, this could be the answer. But if it is given in the parotid region, it should be tracheal pointer should be the answer. Okay. And pinnaplasty age was asked. I told you it should be done after 6 years. Among the given options, the nearest option was 5 to 7-year-old. So you can choose that, right? So if muzzle was asked, then it was cricothyroid. Okay. If muzzle was asked, it was cricothyroid, right? Okay. Okay, fine. Right. Rhinoscleroma management. I didn't get the options clearly. So what was the exact question on rhinoscleroma? Was the options given as surgical options were given or medical management was given? Usually medical management will be your streptomycin, rifampicin, tetracycline will be there. So Klebsiella was also mentioned in the question, if I am not wrong. Right? Right? If surgical management was asked, then you have to stenosis repair. You have to remove the nodules. Okay. Right. Okay. Both option was also there. Okay, fine. Right. So you have to medically give antibiotics to kill the bacteria and to reduce the stenosis, to clear the stenosis. The formation of nodules was there. To remove that nodules, you have to go for surgical excision of the nodules then, right? Antibiotics plus surgery. So B is surgery. If C is both, then this will be the answer, right? Right. How do we do biopsy in this case? You have to go for excision biopsy. So you have to completely excise this, okay, and you have to send it for biopsy, right? Chronic sinusitis, saddle nose was given. Saddle nose deformity is seen in your septal hematoma complication, granulomatous diseases like tuberculosis, sarcoidosis, and your Wegener's. In all those cases, you can see saddle nose deformity. So this image was also given and asked laryngomalacia, omega shaped epiglottis, right? Okay. No, you can go for complete excision, no? You can go for complete excision biopsy for a small tumors, no? If it is of large size, then you may go for wedge biopsy. If it is of small size, you can go for excision biopsy, no? Okay. Any further questions are there? Cricothyroidotomy site, okay, fine. So overall, the paper was easy, I think, right? I didn't get the exact options, so I will fill it and again I will post it in the app as a recall. I mean, okay, your PYQ video. Any further doubts? It was large. So if it was large, you can go for wedge biopsy. If this was large, then large size, then you can go for wedge biopsy. If this was the image given, then it should be complete excision biopsy. Steeple with inspiratory stridor is seen in croup. Steeple sign is seen in croup, not laryngomalacia. No, not brushing. Okay. Any further questions I am missing here? Overall paper was very easy. Fine. So 14 to 15 questions have come and it was very easy, right? Straightforward. Many of are IBQs, image based questions, right? Okay. So any doubts you can personally message me. So with this, I'll be closing my session and next faculty can take on. Muktaji, you are there?
Thank you, Dr. Pradeep, sir. I'm Dr. Gaurav. I'll take over
Hi,
now.
sir.
Hi, hi.
Okay, sir.
Okay. So as you were saying, there was a lot of image-based questions. Same is here, I think. Lot of
Yeah.
image-based questions.
Yes, sir. They are mainly concentrating on image-based things.
Yes.
Straightforward, easy questions.
I know. But for undergraduates to answer for us, it might be straightforward. But for undergraduates, it will be a little difficult. है ना? So, chalo,
Okay,
I'll
sir.
take over. Thank you.
Okay.
Thank you. So my take would be, yes, there were 15 questions and all. I have out of that, I think I've got 12 or 13. And the one or two, I think I'll get by another day or two. Okay. So, hello everyone. Most of them were image-based questions. And yes, as Dr. Praneeth's question I can see, they were focusing more on the management part. Okay, they expected the undergraduates to know how to manage things, okay, which is a little okay. Okay. So thought difficult. I would say it's a little difficult for undergraduates to know all the managements also. Okay. So let us recall. Okay. So first question which was there is this image was given. Okay. This kind of image was given in which they asked what is this instrument used for? And what is this instrument used for? This is JCC, Jackson's Cross Cylinder. Okay, this is used for refinement of cylindrical axis and power. Okay, it is made of two cylindrical powers, plus and minus. Okay, so there is plus 0.5, plus 0.5 in one axis and minus 0.5 in other axis. And there is a handle which is at right angles to this. Okay. Yes, this was there in one of the mocks. So Jackson's cross cylinder. And any other options? I have not been able to get the other options. Okay. ये तो correct है. Okay. B, C, D, other options I'm still waiting for. As soon as I get, I'll let you know. But this was the correct option. Refinement of the cylindrical axis and power. So curvature of the lens. Okay. Curvature of lens was one option. Any other? ऑप्शंस जो है विजुअल एक्टिविटी ऑफ विजुअल एक्टिविटी नहीं विजुअल एक्टिविटी तो ऑब्वियसली आई एम वेरी श्योर यू गाइस नो विजुअल एक्टिविटी इज बाय स्नेल चार्ट एंड लॉगमार्क चार्ट. ठीक है, यही याद है, वही काफी है. चलो, वेरी गुड, दैट इज एब्सोल्युटली राइट. Finding in the images given and what will be the preferred treatment. So they had given this kind of image. They expected you to reach the diagnosis and tell us the treatment also. Okay. So this was Horner Tranta spots, है ना? Horner Tranta spots seen in hot weather, है ना? Hot weather, which is VKC. And what is the treatment for VKC? It is master stabilizers and steroids, है ना? Oral का तो कोई रोल नहीं. There is no role of oral antihistaminics. Antibiotic definitely no. Okay. Fourth option was surgery. Okay. Surgery क्या करेंगे इसकी? These are just the spots, है ना? Fourth option. Thank you for the fourth option, Dr. Ritika. Thank you. ठीक है. So this was a very easy question. But I expected you to reach the diagnosis and then tell us the treatment. Okay. Next question, okay, where many of you have got a little confused between the vision and refraction. Some of you have got confused between these two concepts, okay. Child has a vision of 6/6 in one eye, the other eye is 6/60. The probable diagnosis is this. What I've gathered is that there was this not such a small question. It was a long question. It was a long question. And in this, they had given something like +4 diopter also. Kuch +4 diopter bhi diya tha. +4 diopter. This was a esotropic eye. Esotropic eye, which was there. So what was there? Okay. +4 diopter difference was there. +4 diopter difference. 4 diopter both eye. Okay. 4 diopter both eye. So yani ki if they have given +4 diopter both eye, that means that refraction is same. है ना? Refraction is the same. So how it will be anisometropic? Anisometropic में refraction has to be different, है ना? Okay, so both eye has, yes, +4 diopter for both eye, तो refraction anisometropic नहीं रहेगा. So this is strabismic amblyopia, है ना? Strabismic squint. One eye has 6/60, the other eye has 6/6. Okay, 6/60 and 6/6. Some cover test was mentioned with it. Okay. Cover test. Okay. If you do cover test in this patient also, even then when you cover this eye. So if you cover this eye, okay, if you cover this eye, what will happen is this eye will tend to move in the center. Okay. This eye will move in the center even if it is amblyopic. Okay. Even with amblyopia, this eye will definitely move. Good eye deviates when disease eye covered. Yes. But a disease eye, to this one, this is the disease eye, na? And this is the disease eye. If you cover, तो disease eye कैसे होगा? ठीक है? 6/60 था या 6/36 था? Even then, it is a strabismic amblyopia. ठीक है? Strabismic amblyopia. Amblyopia. Question was on amblyopia. Question was on amblyopia. Choices were amblyopic only. Some other choices. I hope the choices were on amblyopia only. है ना? ठीक है? So here it is the strabismic amblyopia because the squinting eye, the eye which is squinting, okay, squinting eye undergoes amblyopia. That is, vision is less than 6/36 or less 6/60. The vision is reduced. Okay, beta. Good job. Very good. Very good. Next, there was this question with post-chemical injury. Chemical injury, some say. So there was this image which was given. Again, an image-based question. Lot of image-based questions. कोई बात नहीं. So question. So that is where Dr. Mahmood we need to see. Here it is symblepharon, beta. Symblepharon. Ankyloblepharon is when the two lids are joined together. Here the conjunctiva is joined to the eyeball. Okay, the lid is joined to the eyeball. So this is what is called as symblepharon. Okay. So this is symblepharon. Okay. Next, which was there, question number 5. Very simple. We have done this in our class. We have done this by this name only, investigation of choice. Investigation choice. Okay. This image was given. Again, they expected you to see the image, reach a diagnosis. So the diagnosis is keratoconus, and then tell us. So it was a multiple, what I believe in this FMG exam, they have done it in a multiple level. So they wanted one level and then second level. So first level is reach a diagnosis and then tell me what is going to be the diagnosis, the treatment of choice, the investigation. It is going to be topography. Yes, topography, that is the correct option. Corneal topography, absolutely done. And we have done this. This was there in the class. Okay, good. All good till now. So questions were, yeah, this is Munson sign, absolutely good. Questions were a little tricky, but they were from your PYQs and PYTs. All the questions that we have done till now are from PYQs, PYTs. Okay? But yes, it was a little tricky way they had asked. They asked, yes, they asked the treatment, they asked the management. They expected you to be thorough with your knowledge. Okay, very good. Now, this kind of image was given, and then given something like restricted ocular movements. Full option sclera topography. Sclera topography, अच्छा. Sclera topography. Sclera topography कुछ नहीं होता बेटा. ठीक है. Yes, this was thyroid eye disease. Absolutely good. Thyroid eye disease. It is not orbitocellulitis, not cavernous sinus thrombosis. In both of them, there is going to be inflammation. The inflammation is a part. Inflammation includes redness of eyes, है ना? Red nose, redness. Here, the eye was not red at all. This kind of image was given. Bilateral proptosis. Okay, so this was a thyroid. Idiopathic bulging. Okay, fourth question was idiopathic bulging. Idiopathic bulging. Here also what I have gathered is that it was a long question. It was a long question, which you are unable to recall. Many of the students are saying, sir, questions were 4-line, 5-line long. Okay. Inflammation, dryness. Okay, so there was given inflammation, dryness was given. One student was saying the patient had a bindi. Female patient. They were saying it's a female patient. Too much information. Too much information. One of the options was ultrasound B scan. Okay, one of the options was ultrasound B scan. Okay, so I think this option was not there. Maybe ultrasound B scan was there in this option. Okay, chalo. वो भी नहीं है. That is not the correct option. Increased intracranial pressure with feeling of pulsation. Also mentioned. Increased intracranial pressure. Okay, वो उसका क्या रोल होगा? Increased ICP with pulsation. Pulsation क्यों? In keratoconus, A scan given. अच्छा, in keratoconus, A scan was given. Okay, one was A scan. So biometry भी नहीं रहा होगा option में. तो one was A scan, one was ultrasound B scan. Maybe topography, pachymetry. Very good. Thank you. Thank you for filling up the choices. But here the answer is thyroid disease. Okay. Moving on to the next question. Question number 7. So this kind of image, again an image with question. And they wanted to ask the treatment. So again, reach a diagnosis and then tell us the treatment. So this is a viral keratitis. This was clear. Viral keratitis. Some people are getting confused whether it is a geographical ulcer, whether it is a dendritic ulcer. But here to viral keratitis. Okay, branching kind of pattern. This kind of pattern is seen in viral keratitis, whether it is geographical, whether it is your dendritic ulcer. And treatment is acyclovir. Treatment is acyclovir. ठीक है, corneal keratometry. Yes, corneal tomography लिखा होगा. Very good. Almost 150 image questions. Oh my goodness, that is too much. I believe. So as an examiner, I'm telling you, it's a little tough. It is a little tough for the students to see the question, see the image, reach a diagnosis, then tell the answer of the, so it is a little tough. Okay? Otherwise, the questions are okay. Acyclovir 3% cream with atropine. Okay. And okay, one option was Jan cyclovir. Jan cyclovir, nahi beta. Jan cyclovir is not the correct option. That is there. Hemangioma was there in question 6. Acha, one was hemangioma. Okay, ठीक है. Maybe I'll confirm this. हाँ, आ रहे हैं. टेरिजियम सर्जरी पे आ रहे हैं. इसमें ऑप्शन ऐसे कि एंटीबैक्टीरियल भी थी. ओके, एंटीबैक्टीरियल ड्रग्स भी थी. एंटीबैक्टीरियल ड्रग्स सी. ओके, अच्छा, the 3 were antibiotic. Okay, so B, C, D you are saying were antibiotics. So ganciclovir नहीं था as per you. Okay, Dr. Vishnu. So antiviral था ना, this is antiviral. The treatment here will be antiviral beta. Okay, good. Next. So one was this image where the test of choice for the patient for given image. So again an image. What is this image? This is basically an image showing KPs. That is seen in uveitis. And these KPs are on the cornea. है ना? So this is an HLA-B27 associated uveitis. HLA-B27 associated uveitis. Okay. Antiviral ointment with cyclovir. ठीक है, तो antiviral ointment with cyclovir. अच्छा, antiviral लिखा हुआ था. ओके, तो ganciclovir किसी को ऐसे ही याद आ गया. Antiviral ointment with atropine. That is the correct option. इसमें HLA-B27 था ना, तो HLA-B27 is the correct option. Anti-CCP antibody दिया था. ओके, anti-CCP antibody नहीं, वो भी करेक्ट नहीं है. HLA-B27 will be best. Question 7. Antifungal, antimicrobial. ओके, ठीक है, अंडरस्टूड. वेरी गुड. चलो अब आगे चलते हैं. वो हो गया क्वेश्चन. लेट अस मूव टू दिस वन. इसमें कुछ और क्वेश्चन में कुछ और था. एनीथिंग व्हिच वाज पेक्यूलियर टू दिस क्वेश्चन? It was not B27, it was anti-CCP. But actually, I went to B27, many have told me. Okay? Many have told me that it is actually B27. Dr. Abhishek Tiwari. If not, okay, then what you can do is you can WhatsApp it to me at this number. Let us discuss at this number. Okay? HLA-B27. See, Dr. Rajkumar is telling. Many students have said कि HLA-B27 था choice में. Unless there were different sets of paper. ठीक है, तो यही होगा. Next. This is a question where one bouncer has come. Treatment of choice for the patient with pterygium. Ideally, it should be surgery plus autograft. But one student is telling me that there was written that this is encroaching the pupillary axis. Encroaching the pupil axis. Yes, it's there. देखो. ठीक है बेटा. Dr. Abhishek Tiwari, see, lots of students are saying कि था. ठीक है भाई, चल मान जाते हैं. लेट अस एग्री. अब मान ही जाते हैं क्योंकि इतने सारे लोग कह रहे हैं. आजकल वही है ना, मेजॉरिटी विंस वाली स्टोरी है आजकल. नोबडी बिलीव्स कि सिंगल पर्सन कैन बी राइट. मेजॉरिटी विन होता ना. आ जाओ. सो नाउ कम टू नेक्स्ट क्वेश्चन. हाँ, एनक्रोचिंग द प्यूपिल एक्सिस था क्या? See, because if the pterygium is encroaching the pupil axis, then you have to wait and watch for the pterygium to grow over the pupil. No picture was there. No picture was there. Acha. For a change, no picture was there. Acha, no image. ठीक है. Okay. Image delete. तो लिखा क्या था? हाँ वो आ रहा हूँ डॉक्टर सविनीत कोहली सेठी। ओ भाई साहब इतना लंबा नाम है। आ रहा हूँ बेटा, आ रहा हूँ। दैट क्वेश्चन इज देयर, कमिंग टू दैट क्वेश्चन आल्सो। नो पिक्चर वाज देयर, चलो ठीक है। नाउ टेरिजियम एंक्रोचिंग द प्यूपिल एक्सिस था, लिखा था। रीचिंग द कॉर्निया ना, रीचिंग द कॉर्निया तो है ही, टेरिजियम विल रीच द कॉर्निया ओनली। टेरिजियम विल डेफिनेटली रीच द कॉर्निया। रीचिंग कॉर्निया, यस, नो पिक्चर, दिस इमेज वाज नॉट देयर। ठीक है, हाँ आई एग्री, दिस इमेज वाज नॉट देयर। ठीक है, डिलीट हो गई इमेज, फॉरगेट द इमेज। ठीक है, तो अगर खाली टेरिजियम था, एंक्रोचिंग द कॉर्निया था, देन द ऑप्शन इज सर्जरी प्लस ऑटोग्राफ्ट। But if the question said कि it is encroaching the pupil axis, then it would be wait and watch. You want the pterygium to grow. From nasal side भी ठीक है, सारे टेरिजियम नेजल साइड ही होते हैं, सारे टेरिजियम नेजल साइड ही होते हैं। हाँ ठीक है, ओके। रिमूव आई, हे भगवान, एक क्वेश्चन था रिमूव आई, एक ऑप्शन ये था रिमूव द आई, पूरी आई निकाल दो। नो पीपल एक्सेस मेंशन ना, ठीक है। सो ओनली वन स्टूडेंट मेंशन दिस, सो आई विल रिमूव दिस। नहीं, फेस्टून पीपल आगे था बेटा, वो आते हैं और क्या। एक लेंस सबलक्सेशन इमेज वाज गिवन, वाज देयर अ क्वेश्चन ऑन लेंस सबलक्सेशन? लेंस सबलक्सेशन पे कोई क्वेश्चन था क्या? था, तो व्हाट वाज द क्वेश्चन प्लीज? आई एम नॉट एबल टू गेट दिस क्वेश्चन आल्सो, नीदर आई हैव बीन एबल टू गेट द choices. I just got to know that there was a question on lens subluxation. ठीक है, I'll see and get back to you later on. एक ये क्वेश्चन था, blunt trauma to eye, अच्छा इसमें इमेज था, ओके, दिस वाज एन इमेज बेस्ड क्वेश्चन, सो आई हैव टू सर्च फॉर द इमेज आल्सो, चलो करेंगे। ठीक है, नाउ देयर इज अ blunt trauma to the eye with a tennis ball present with given image, है ना, आफ्टर कैटरेक्ट सर्जरी, आफ्टर कैटरेक्ट सर्जरी, आफ्टर कैटरेक्ट सर्जरी, ओके। व्हाट्स द इमीडिएट पोस्ट ऑफ cataract complication after? Inferior subluxation image was there. Inferior subluxation image was there. IOL was luxated. Post cataract surgery, what will happen? Opacification of IOL. Opacification, subluxation, एफ क्या? हे भगवान, क्या क्वेश्चन है यार। ओपेसिफिकेशन ऑफ आईवेल क्यों होगा? पीसीओ होगा यार, विद इन कैटरेक्ट सर्जरी। चलो देखते हैं, I'll get back to this. Now what was this? Presents with given image, tennis ball injury presents with this given image. This was obviously, आ रहा हूं उस पे भी आ रहा हूं, this was obviously hyphema, obviously hyphema है ना बेटा, ये hyphema ही है, 8 ball hyphema। हमने ट्रॉमा किया है, we have done this repeatedly ट्रॉमा में, and we have done this same image, yes, good, thank you। हाँ, and one question was on, so question 12, one question was on LASIK, on LASIK surgery criteria, ठीक है ना, where they had given one, age 13 years, corneal thickness they had given as 480 microns, है ना। one question was, one choice was 6 diopter या फिर शायद 4 diopter myopia, cannot be done, LASIK surgery cannot be done, cannot, ठीक है। और corneal thickness 480 micron, so you can do here, you can do here, you cannot do in age less than 13 years, एज लेस देन 13 ईयर्स नहीं था, ठीक है। हाँ 4 डाप्टर ठीक है, चलो 6 डाप्टर नहीं था, नॉट फिट फॉर सर्जरी ना। हाँ अच्छा ठीक है, एक वो था स्टेबल फॉर 1 ईयर, स्टेबल फॉर 1 ईयर, ठीक है. Now, one question which was there was question number 13, which is there was a festooned pupil image, festooned pupil image was given, where they are saying along with myotics, what drug given to break the signing. Okay, I had put this question. I don't know why this question is not there in my PPT, but I had written this question. But chalo, koi baat nahi. One was atropine. Second was cyclopentolate. ठीक है. One was phenylephrine. And one I think was scopolamine. है ना? One was scopolamine. I think these were the 4 options. Cyclopentolate na? So see, which of the following is not a criteria for LASIK? Yes. So age 13 is not a criteria. It is not a criteria for LASIK. Yes. Stable refraction for 1 year is conjugate 480 micron. Yes, is. हाँ, ठीक है. So इसमें the correct answer is atropine, beta. The correct answer is atropine. Atropine is something which is the strongest. This is the strongest cycloplegic mydriatic. Cycloplegic mydriatic. So that is why you use atropine to break the signing K. Age 113 years. Think. So phenylephrine was also there. Prevents, yes. So atropine is something which is given, beta. We have done this. It's the most important adjuvant drug for uveitis. Apart from steroids, this is the most important drug that we give. गलत नहीं मेरा, simple था यार. Atropine we have done. They have just twisted the question. This was there in our class also. What is the most important adjuvant drug? है ना? अच्छा, one glaucoma question was also there. Okay. Question 14. One glaucoma question was also there. Along with myotic. I don't know why they've given along with myotic. Please understand, myotics are contraindicated. Okay, I don't know why they have written this, but I'll write it here. Myotics are contraindicated in uveitis. Okay, because they will worsen the synechiae, worsen the inflammation. Myotics are contraindicated. I don't know why they've asked this. Okay. Now, one question on glaucoma you are saying was there. What was this question? Which drug breaks myotic action? So atropine breaks the myotic action. Atropine breaks the myotic action. ठीक है. Which drug add with myotics? I don't know why you will add with myotics. Add क्यों करेंगे? Myotic देंगे ही क्यों? Why would you give myotic only? There is no reason to give any myotic. Secondary glaucoma था. Other option was. अच्छा. So here you are saying one option was open angle glaucoma. One option was secondary glaucoma. Okay. Glaucoma with the image. Here also it is image-based question. Oh my goodness. So out of 14 questions, 15 questions, I think 13 were image-based. Only one was not image-based. ऐसा था क्या? Lot of image-based question. Good. चलो. So we'll search for this question also. One primary glaucoma. अच्छा. तो open angle glaucoma हो तो क्या? Primary open angle glaucoma. That is primary glaucoma only. Okay. Angle closure glaucoma. Okay. So one you are saying is angle. Choice C was angle closure glaucoma. But what was the question? Question is, what was the question? That is my question. What was the question? Mention pain and redness in the previous question. अच्छा, pain and redness. अच्छा, pain redness mention कर दे यहाँ पे. ठीक है. Pain and redness. चलो, करेंगे mention. ठीक है. For the timing, I hope you were able to answer them. They were little tricky questions. I would not say they were easy questions. But yes, They were all your PYQs, PYTs. So if your concepts were good, I think you should have answered them. ठीक है, ये मेरी तरफ से था. ठीक है, and hats off to all your efforts and a big thank you to everyone who has contributed to this recall. ठीक है, that is what I can say. And all the best and see you soon at Cerebellum. है ना? Let us all hope that we clear this exam. And I think I'll hand over to the smartest fellow amongst in Cerebellum, to Dr. MSD.
Thank you so much, sir.
Right.
And that was a detailed discussion of ophthalmology MCQ. So many image-based questions, sir.
I think all of them were image-based questions. I don't know. And as looking at Dr. Praneeth's questions also, they were also very image-based questions.
Yes, sir. Even in dermatology also, there were many image-based questions, sir.
No, ophthalmology is normally a little mixed of these images and these theory questions. And in every image-based question, they were asking the management or the test or they were not just staying at reaching a diagnosis. They were going one level beyond that. So, okay, for undergraduate, for FMG, it was a little tough, I think. But
so basically, they are increasing the difficulty level of FMG and making it almost NEET and INICET level, sir.
Yes, parallel to the NEET levels. I absolutely rightly you pointed out that they're just reaching the NEET level. So I think they should rather they should combine the two exams rather than having them separately.
Yes, sir, that would be best.
Chalo, ठीक है. All the best and over to you, Dr. MSD.
Thank you so much, sir.
I'll scoot off. Thank you.
Thank you so much. So, chalo, dear students, so myself, Dr. Madhuri Srinivas, I'm a dermatology faculty on this wonderful Cerebellum Academy. So, this dermatology recall, so because it is possible because of so many students who were able to give me some bits and pieces, some options were missing. So, if you feel anything is to be corrected, please do let me know in the comment section. I will read all the comments, right? So, if there is any difference in the question or in the options or in the images, you can put it in the comment section. I'm watching it. So was this question there? A female, the question says female is presenting with grouped vesicular lesions over the upper lip and there were target lesions present on the extremities. What is the most likely diagnosis? So was this question there? I hope it is there. And yeah, lip photo was not given. Okay, fine. Lip photo was not given. This was not there. Okay, yeah, rest I think this target lesion picture was there or was it mentioned in the question? Acha, women's lip they have mentioned. Okay. Right. Okay, chalo. So if you combine these two, so like, they are trying to integrate the subjects and also in the subject also they are trying to integrate different topics. So if there are, grouped vesicular lesions over the lip, what is the diagnosis you will think of? Herpes labialis. Right? And if you remember, we have discussed erythema multiforme, which will present with target lesions. The important reason, the important etiological factor responsible is the infection, and that is herpes labialis. So this is a two-layered question. So answer here is going to be option B, erythema multiforme. Right. Okay. Acha, vesiculobullous was given. Instead of grouped vesicular, they have, given vesiculobullous. So this is what students are giving. Okay. Right. Vesiculobullous. Okay. Answer is erythema multiforme. If this is the question which was asked. Target picture is there. Okay, this picture is there. Thank you so much for the confirmation, Dr. Was this Dr. Rathod, Avani Rathod. Thank you so much. Right. Chalo. So next is, and there were so many STD related MCQs from dermatology in this paper. So this is one among them, a 40-year-old truck driver presenting with single painless ulcer in the oral cavity. On examination, painless ulcer on the penis and at the corners of the mouth was noted. Based on this, what is the most likely diagnosis you want to think of? This was the question. Right. Okay. Was this question there? And what do you think is the answer for this question? Was there any image which was mentioned where there was an ulcer present in the lip or over the tongue or over the corners of the mouth? Any image was mentioned in this question? Yes, dear students? Not painless. It was painful. Acha. Okay. But students told me that it was painless. Okay. Let us see what other students had intercourse with Acha. Acha. Okay. So there was a mention of sexual intercourse with the sex worker. Okay. Painless. Acha, no image was there. So yeah, this history, and I hope you remember truck drivers, the persons who visit Thailand, they are going to have high likelihood of development of sexually transmitted disorders, right? So in this case, what do you think is the possible answer? Painless ulcer, genital ulcer, painless genital ulcer. Where do you see? Yes, it is primary syphilis, which is because of Treponema pallidum. Remember herpes labialis? There's going to be painful ulcers or erosions which will leave behind after grouped vesicles are formed. Okay, and aphthous ulcer are also very painful, and oral lichen planus will present with Wickham's tract. Please tell me whether these were the options which were given for this question or any other options were mentioned in the question. Okay, right. Right. I hope all of you have got the answer. It is primary syphilis, right? Okay. Chalo. Next is this question. So some students told me that this was also given. So individual is presenting with a swelling of the foot and there were multiple discharging sinuses. Okay, and those sinuses, the grains are coming out which were black in color, and it was also mentioned that they were hyphae noted on microscopy. What is the best management strategy? Was this question given? Was this picture and this question it was given? Yes, dear students. So if it was the case, then what do you think of? It is mycetoma basically, and because there are black granules. So what do you think? Which type of mycetoma it is? It is U mycetoma because of the fungus, and also it is mentioned hyphae are present. So what will be the treatment for this case? Treatment is going to be with antifungals with surgical debridement. Antifungals with surgical debridement. Okay, right. Acha, no image was there. Right. Okay, no image. Okay, I'm noting it down. No image was given. Only description was given in the question. Okay. Acha, fourth option was immediate surgery. Okay. Okay, right. With a radiological image. So, was the radiological image given? Image there. Okay. Acha, wait and watch. Radiological image was given or this image was given? Can you please specify that? Acha, same image. Thank you so much. Okay. Immediate surgery, some students are telling that it was amputation. But remember, dear students, so in this case, in for mycetoma, we will start the antifungals, and along with that, we'll try to remove surgically the part whichever has been infected, but not the complete amputation. Same image. Okay. Thank you so much. Acha, okay. Right? Okay. Chal. Next, if you have any concerns, you can put it in the comment section. Right. So next is again a sexually transmitted disease related MCQ. A 27-year-old presenting with transient genital lesion, and it is mentioned that it is resolving spontaneously, and there was painful inguinal lymphadenopathy bubo, which is developing 2 weeks later. And the examiner asked which serovars of Chlamydia trachomatis are responsible for this infection. So what do you think is the diagnosis for this question? So I hope you remember the diagnosis. Yes, it is. We have discussed in our classes. It's not, RGV, it is LGV, lymphogranuloma venereum, right? Which is the causative organism with Chlamydia trachomatis. And I hope you remember that it is going to mainly affect the lymphatics, right? So L for lymphatics. So the serovars are going to be L1, L2, L3. Okay, L1, L2, L3. That's option A is the answer for this question. So D2K, yeah, chlamydia trachomatis also has D2K, but in dermatology, you can remember it is associated with cervicitis and urethritis, right? But not with LGV. Okay, students are telling that one option was MO. I think that was option D, which is MO. So correct me if I'm wrong. So I think these were the options which were given in the exam. Right. Next is this question which is asked n number of times. So there is a patient of BT leprosy, right? And it was mentioned that there was sudden development of inflammation of the existing lesions. So there is inflammation of the pre-existing lesions and the patient is already on multi-drug therapy. So what is the best possible management strategy in this particular patient? This was the MCQ. Was there any image given? Was this image given or any other image looking similar to this image given in the exam? So even if image is given or not, if, by looking at the description, I hope you all know that it is the exam is talking about lepra reaction, type 1 lepra reaction. So type 1 lepra reaction, what are we going to do? We should continue the MDT and we have to start the patient on oral steroids. So option C is going to be the correct answer. We should continue MDT and start prednisolone. Similar image. Okay, thank you so much. This is asked n number of times. Definitely you can mark it correct. I hope you have all marked it right without any doubts. Right. And this is we can say pediatrics, microbiology, and dermatology integration. So this might have been already discussed. So if it was discussed, we can skip it. You can tell me in the comment section. So vesicular rash is present. So there was a fever lasting 3 days, after which there was centripetal rash. That is the rash which is present more over the trunk which was given, right? What is the most likely diagnosis? So I hope everyone of you have marked this correct. So what do you think is the correct answer for this question? Right, absolutely correct. It is varicella. I think chickenpox was not there. Varicella was given in the options. Yes, then that is the case. Varicella, because of varicella zoster virus. Right. Okay. So, okay, Adharva Patil was written associated with fixed drug eruption. For which question was that given? Achha, back image was there. Okay. So instead of this, back image was there. Okay. So Adharva Patil, can you tell was written associated fixed? So in which question was that given? All right, chalo. An individual is presenting with painful genital ulcer. Again, a question related to STD. It is very important concept chapter in dermatology. You can see this is third question, which is from STD topic, sexually transmitted disorders topic. Okay, painful genital ulcer, ragged edges, and tender inguinal lymphadenopathy. What is the most likely causative organism? And this question, I think it is repeated so many times. Very, very important question. And first you need to know what is the diagnosis. The next level you can mark what is the organism. So I hope you remember from the classes. You have remembered the crying crow in the exam most likely. Okay, chancroid. Okay, chancroid. Why? Because both pain ulcer as well as the lymphadenopathy are painful, right? So what is the causative organism? The crow is crying, so it is Haemophilus do cry, right? So like that you can easily come to the answer. This is actually a difficult question. We can say if you don't know the clinical picture, you cannot diagnose this and you cannot know what is the causative organism, right? Achha, image was given for this question. So which image was given? Can you please tell Dr. Vishnu? Okay. Chalo. Okay, chalo. Right. So this was another question. Individual with a known history of rheumatoid arthritis develops rapidly progressive painful ulcer on the leg, and there is mention of the rheumatoid arthritis. So there is undermined edges and violaceous border for this ulcer. And what is the most likely diagnosis? This was a question. So this is actually a NEET level question. It was a previous NEET question. So this is a example of a neutrophilic dermatosis. which is pyoderma gangrenosum, which is going to present as a painful ulcer, mainly over the legs, which will have this violaceous border at the margins, right? So this is a classical picture, which was, I think, given. Many students told about this, right? Okay. So if you feel anything is missing or anything is extra, you can put it in the comment section. Next question, child presenting with itching, which is predominantly present on the extensor surfaces. A positive family history of asthma was also mentioned in the father. So based on this presentation, what is the most likely diagnosis? Right? Right. Yeah. This is atopic dermatitis. So if you remember, according to Hanifin-Rajka criteria, we have major criteria in which itching is one of the important criteria, and also lesions which are present over the extensor surfaces in the childhood, and the positive family history of asthma, or we can say any type of atopic history, atopic diathesis. So these are the points which are favoring for atopic dermatitis. It is option B. Next is this woman with diabetes presenting asymptomatic skin lesion, and it was non-scaly and it was annular lesion. So these were the points, clues which are mentioned by students in the recall. What is the most likely diagnosis? Right? So please remember, students, tinea corporis, it will be scaly and it will be itchy. So it cannot be tinea corporis. Lichen planus, it will be very severely itchy. So that cannot be the answer. And also psoriasis, it will present with lot of scaling. And in fact, hospit sign is also associated with psoriasis. Right? So what will be the diagnosis? Even if you have not read about granuloma annuli, you can answer this. And can you tell me, were these the exact options or any other option was given? If these were the options, you can rule out the options very easily with the clues given in the question. Thank you so much, ivermectin. So the recall is so accurate. Yes, thank you so much. And yeah, so if you are having any differences or any other questions you feel, there was students told me that there was a question on scabies. So can you tell me what was the question related to scabies which was asked? Okay, thank you so much. Right. Was there a question on scabies, and what was the question? What was the options? Can you please tell? And I hope all of you have made most of these questions correct. So even if you have made some of them wrong, it's okay, because some of the questions were of NEET and INSET level. I agree. Scabies was an option. Okay. Itching at the night. Okay. Extensor surface itching. Okay. Itching at the night. So this was the answer. And the examiner has given itching at night. Okay. Okay. So any other question which you can remember, anything related to lupus erythematosus? Acha, scabies was an option. The question was atopic dermatitis. Acha, okay, okay, fine. So some students are telling that scabies was the option in the atopic dermatitis wala question. Right, chalo. So here, so which option was not there? Which of the options was not there? Cradle cap, contact dermatitis, irritant contact dermatitis. Okay. Something like that. Okay. There were scales, itchiness on the face and on the extensors. Okay. Face and extensors. Okay. So instead of irritant contact dermatitis, there was scabies in the option. But still remember, scabies is going to be associated with nocturnal itching. And there will be history of similar itching complaints in the contacts. But here the important clue which is given by the examiner is the history of asthma in the father. So why would a scabies patient have a asthmatic father? So that does not make a sense. So exam is trying to tell you that, and also it is mentioned that face is having the itching and scaly lesion. So usually scabies, it will affect in the infants only, it can affect the face, but otherwise in the atopic dermatitis, we can see the involvement of the face in the infants and also in the childhood phase also. right? So that is going to favor more towards atopic dermatitis rather than these scabies. So I hope it is clear. Achha, nocturnal itching was not there in the question. That is what ivermectin is doing. And any other question related to systemic lupus erythematosus was given? Okay. Okay. No. Chalo. Chalo, okay, you have done your hard work. Now you can relax for a few days. You can watch all the movies which are there on these platforms. And those who are watching this for the NEET exam, definitely you should continue the studying for your 2026 examination. Don't worry, you're going to do great, awesome. And you can reach me out on Telegram for any queries related to the question or the options. Thank you so much. Yes, we can now hand over the session to
I'm
Mukta
there,
ma'am.
sir. Hello, sir. I'm there.
Oh, very good evening, sir. Vivek Jain, sir.
Good evening, sir. Good evening.
Okay, so please take over, sir, and continue the discussion of the PSM, sir.
Thank you so much, sir. Thank you so much, sir. Okay, hello, friends. How is everyone doing? How was the exam today? See, after the exam, I got a frantic call from a student. Student was saying there were only 3 questions of PSM. I asked him to relax, take time. And now I'm having 28, 29, 30 questions of PSM with me right now. So if you are ready, shall we start discussing? So we are looking at PSM FMG January 2026 recall. Okay, so let us start. We have in our session, Dr. Ivermectin never ending also is there. Okay, friends, this was one question which we were having. Which statistical test is most appropriate for comparing cholesterol levels within a single group? So just go back to what we had discussed in the mission classes or even in the marathon rapid division classes also. When you are comparing cholesterol level in a single group, then that means we are taking two values, before, after. Before, after means which test we are going to apply. Please confirm if the choices were correct. Yes, it is paired student t-test. Friends, I have prepared all these questions in last 1 hour only. So anywhere you find PSM was not there, ज्यादा नहीं था. 30 questions are there with me, तो 30 तो discuss कर लेते हैं, Dr. Yuhan. So paired student t-test before, after. Please don't worry about the things which were not there. Check out of these 30 whether you managed to attempt 25 correctly or not, because majority of students are saying they were able to attempt 25 out of these correctly. So let's look at this. So this is within a single group. Okay. Any number of people may be there. Comparing cholesterol level in 300 patients, you are seeing. If it was two different groups, then it will be unpaired. So you have to confirm me whether it was comparing cholesterol level in a single group. Original students have confirmed it is paired student t-test if it was a single. I'll come to everything, Dr. Sakurao. I have this question of Pearl index calculation also, right? Okay. Number of patients don't make a difference if it is a single group before, after. Parametric, normal distribution, quantitative data we have discussed. Paired student t-test. Same question has been asked earlier in your exam as mean systolic blood pressure before, after an intervention, right? Yes, Dr. Ritika Shukla is absolutely right. Question 2, was this a question which plastic bag is not contaminated with blood? If these were the 4 options, then black. Why? Because black is for municipal waste. Municipal waste. It is for non-infectious waste. So municipal non-infectious waste. So kindly confirm if black bag you have marked as the answer. There were 4 questions from biomedical waste management. We'll come to them one by one. Please confirm, friends. Which plastic bag not contaminated with blood? That questions will come later. Just confirm if this question was there or not, or was there image given in the choices, or yellow, blue, red, black was written in the choices. TPN bag is a separate question. There was another question we will discuss on expired medications also separately. Yellow bag incineration was a separate question. Right? Okay, this I will then relieve from the list. I'll reduce from the list. If you're saying I'm looking at the YouTube right now, you are saying TPN bag with tubes intact. We'll come to that question. Okay, look at this question. Rural program has increased number of vaccination, increased hospital delivery, increased access to healthcare. But when you compare it with urban areas, it was really less. Which of the following pillars of primary healthcare is most likely to be exploited? Can you answer this question? What you have marked in the exam, friends? We are looking at rural area doing very good. But when we compare with urban areas, it is still very less. This is a type of. The services should be equally distributed across geography, across socioeconomic status also. So look at this question, friends. 2-year-old child, bluish white spot. So we are looking at coplic spot opposite second molar tooth. Second was not mentioned. Students were telling me he has a history of cough and fever. Cough, fever, and even that is not required. Once they mention coplic spot, I think 100% of you must have marked this answer correct. Yes, it is not on tooth. When they say in front of this, they are talking of buccal mucosa only. So you ask the child to open the oral cavity. If you can see in front of molar tooth, second, on the buccal mucosa. Can you please confirm the other choices? Can you confirm the other choices, friends? Even if molar tooth is not mentioned, only buccal mucosa is mentioned. Even then, bluish white spot, cough, fever, we are talking of measles. Okay, choices were fine. Mumps, rubella, measles, and chickenpox, as the students have reported. Okay, tooth was not given. I have excluded from the language. Please help me correct the questions. Help me correct the choices also. But I am sure this question, 100% of you must have marked correctly. Okay, can we move forward to the next question, friends, immediately? Okay. Yes, questions may be a bit lengthy because students, when they tell us in a single sentence. So whatever information we could get, by tomorrow, I will get almost all language. Cough and red eyes. Yes, that is correct. Congestion of eyes is characteristic. Also, retroauricular origin of rash. If they mentioned the rash started behind the ear pinna, that is also very confirmatory of measles, right? Okay. Look at this question. Anemic woman, second trimester of pregnancy. They mentioned receiving iron folic acid under Anemia Mukt Bharat. What should be added to regimen to improve the efficacy of therapy? If you look at this, they are saying efficacy of therapy. Older FMG question repeated again. Vitamin C helps in improvement of absorption of iron in the diet. Only 10% only facilitator. Everything else is a inhibitor. Then there was a question. Patient of Northeast India, fever and chills, peripheral blood smear shows Plasmodium falciparum. So when they're saying Northeast, some students mentioned state Meghalaya was mentioned. So any state of Northeast or Northeast was mentioned. And we are looking at Plasmodium falciparum. We cannot give ACT SP. We will have to give artemether lumefantrine with primaquine, right? Primaquine. So artemether lumefantrine primaquine. I'm sure dosages must not have been asked because in your exam, generally for anti-malarial drugs, they usually go for the name of the drug. Okay, Manipur was mentioned, not Meghalaya. Okay. So any northeastern state, answer remains same. Answer remains same. Right, great. Okay, adding sodium to butter is fortification. Dr. Abhishek, I was not having that question. If you are adding sodium to butter, but you will have to give me other choices. You only gave me fortification, that looks right. Prima queen is for 14 days. Yes, Prima queen is for 14 days. That is correct. Prima queen is for 14 days. 14 days, yes. Was this the pond image they were asking? Pond image, a similar or this pond image was asked. If they're showing you like this, look carefully. This is a type of step well. They must have shown a better image. Students are not able to describe the image correctly. So if they are showing a step well in which people can climb down, then we are looking at guinea worm. We are looking at guinea worm. Guinea worm. Vitamin A2 butter is food fortification, Dr. Priya. If you are saying it was not sodium, vitamin A, that is food fortification. So vitamin A and D is added to dalda oil also, butter also, that is fortification of food. This is guinea worm. People walk, then it can enter cyclops body. People are consuming. See, when people consume infected water containing cyclops which are infected, reaches, a person walks through the step well, water comes contact, skin of the leg ruptures, and suddenly the cycle is completed. Doesn't matter if there were pots near the step well also. Pots near the step well also, right? Okay. So this is guinea. Okay, this was an image given, rule of halves. Every time it comes in your paper, if you remember in one of your GTs also, we kept a similar question. What was mentioned was that prevalence of the disease was not 50%, I think it was 30%. Is it, if the prevalence of the disease was 30% who are having hypertension, then out of them, 15% will develop symptoms, half of them. So if prevalence was 30, half 15, half 7.5, half 3.75. So it was purely a mathematical calculation. Right? Okay. No image was there. See, even if image is not there, we know there are four things. Total population, 50% have hypertension. Half of them get symptoms. Half of them seek treatment. Half of them get adequate treatment. So within the total population, there are four circles inside. This we have to remember. Right? Okay. No, this is, I'm sure that this question was there. This has been confirmed by many students that 30% prevalence, and they asked how many get adequate treatment. Adequate treatment. Right? Okay. Yes, this is true for developing country also, developed country also. 3.75% will get adequate treatment. Innermost circle. Innermost circle. Even if it was not so simple, they will have to mention that 15% get symptoms, 7.5% seek treatment, and 3.75% get adequate treatment. Any one of these three will become the correct answer, will get the correct answer. Okay, there is a question. Which of the graphs should be used to depict the following data? Again, these numbers have been told by students. Numbers may be a bit changed, but look at this. Salt intake, blood pressure. You can see as the salt intake is increasing or decreasing, we want to see whether blood pressure is increasing or decreasing. So this is which diagram I should use. Which diagram I should use. 3.75 with two different options, then 3.75 will be the innermost, adequately treated. Okay, friends, this question, can you confirm? We are looking at salt intake, blood pressure. So we are trying to establish relationship between two quantitative variables. So I'm sure all of you must have marked scatter diagram as the answer. Correlation, yes, relationship between two quantitative variables. So this is fine. Okay, let us move forward. This has been confirmed. Values may be a bit different. 4.1, 3.2, 5.1, because it's not easy for students to remember all these 10 values after the exam correctly. Yes, even if salt intake is in ascending order, that would have been a better way to represent. Blood pressure increasing or decreasing with that relationship is established by. So what I will do, based on your recommendation, I will put this number here, right? Okay, thanks. Then there is a question first to confirm which image of Ayushman Bharat was there. Ayushman Arogya Mandir, which image was there? Was it number one? Was it number two or something else? But students told me that image of Ayushman Arogya Mandir was there. But they were not able to share the exact question. Exact question. Can you tell me what was the question? Question something was what students have told me. Identify the image, mark which of the following change has been there in the National Rural Health Mission. Okay, second image was there. Okay, so I will remove this image. Okay, so let us look at this image. Can you tell me the question? What was asked exactly? What was the question asked? Because students were not able to tell me the question. No name or image was there. No image was there. Image of Ayushman Arogya Mandir was there. They asked the other name. Other name is Health and Wellness Center, as we have discussed in the classes also. Last time also in your exam, there was a question on Ayushman Arogya Mandir does not provide services related to laundry. Other health, diagnosis, treatment related services, essential drugs, everything is available at Ayushman Arogya Mandir. Right? Okay. Yes, this is a sub-center. Sub-center health and wellness center. So one of them has to be. Yes, okay. If they ask its new name, the new name of this is now Ayushman Arogya Mandir. So please confirm, new name of health and wellness center is Ayushman Arogya Mandir, right? Okay. Okay, Ayushman Arogya Mandir was in the option. Okay, that is good. In fact, that makes the question even more easy for us. So I hope all of you have marked this answer correct. Even if name was hidden. Was the name written on the image in Hindi or English that Ayushman Arogya Mandir it is? Was this name written, this one, in the image? New name is Ayushman Arogya Mandir. Earlier it was Health and Wellness Center, sub-center under Ayushman Bharat program, came to be known as Health and Wellness Center. That came to be known as Ayushman Arogya Mandir. No name was there on the photograph. Okay. No name was there on the photograph. Okay. So Ayushman Arogya Mandir. Okay. TPN bag is thrown into which biomedical waste management bag? I think this was also a fairly direct question. TPN bag means we are looking at plastic, which is a contaminated recyclable waste. Can you tell me plastic red colored bag, contaminated recyclable waste? Which bag should be used? Yes, it will go into red bag, right? Okay, we move further. There was a question on expired medication. Can you please confirm if this question was there? Because I was surprised to see so many questions from biomedical waste management, but we have discussed in detail. Was there a question on expired medication? Okay, you are saying here TPN bag photo was also there. Okay, that I will add. Then it becomes even more easy. Plastic photograph, plastic bag. You have seen TPN bag in your hospitals also. Ayushman Bharat program, Ayushman Arogya Mandir is the answer. Okay, incinerator was in the option. If bag is not asked, then yellow bag is subjected to incineration. So you have to confirm, was the bag asked? Was the method of disposal asked? Okay, one option was black. TPN with attached tube. Okay, that I think one student told me also. Attached tubes, that I will add. Expired medication treatment is not through autoclave. Autoclave was in one of the choices. Okay, so it is, yes. So yellow incineration, you just have to confirm. Was the bag asked or the process or both were asked? Bag, process, both. Bag was not asked. Okay, good. So it is incineration. Yellow bag, expired, discarded medicines, incineration should be done. Deep burial was an option, okay. Deep burial we have discussed in the class is only for placenta after delivery at a primary health center. That was also an old question, right? Okay. So we go with disposal. Good. Everyone is confirmed. Then there was a question on calculation of Pearl index, number of accidental pregnancies, total months of exposure into 1200. So you can see 4 upon 3000 into 1200. What is the answer we have marked? Please confirm the choices also. Answer will be 1.6 because other choices students were not able to share. Could you please share the other choices? This will come 1.6 per 100 women years. Okay, thank you, Dr. Vikas. I'll take a screenshot of your question. Thank you. Okay, one choice was 0.8. Okay, this is the answer, irrespective of the choices. One choice was 2. Okay. Answer is 1.6. So I'm sure all of you have calculated this correctly because Pearl index, we discussed so many questions on calculation of Pearl index. This is always automatically per 100 women years. Per 100 women years, it automatically comes, right? Okay. 16 was not there, 4 was not there, 8 was not there, right? Okay, great. Then formula for maternal mortality rate, you have to confirm. Some students were saying ratio was asked, or was it rate? Because both have been asked in your exam earlier. Can you now confirm, friends, whether maternal mortality rate was asked? Then answer will become B. If maternal mortality rate was asked, or it was maternal
विवेक सर के
mortality
बाद
ratio.
वो है
Uh,
बायो
Mukta ji, there is a disturbance at your end.
होने वाला है, ज्यादा क्वेश्चन नहीं है
Mukta ji, there is a disturbance at your end.
हम्म
Team, please.
मैंने तो बना के दिया
Team,
थे
please. Team, it is. Okay. So, friends, please have a look. Have a look. Okay, question was not there. Net reproduction rate will come separately. This question was not there. Okay, I delete. Okay, students were saying this was one of the questions. Okay, let's move further. Was there a question on contributors to dependency ratio? Please confirm the question. I'll come to that. I'll come to NRR question also. Please confirm if there was a question on dependency ratio. Was there a question on dependency ratio? No. Okay. Remove it. Okay. Life expectancy comparison in two countries. Was there a question related to this? Please confirm if there was a question related to life expectancy only told by students on WhatsApp. Please confirm there was a question on life expectancy or human development index. Please confirm. I'm looking at your chat box on YouTube only. Was there a question related to? Okay, there was a question on ICDS program of India. Please confirm that calorie and protein supplementation to a child 6 to 72 months was asked. Please confirm. ICDS program, calorie and protein supplementation to a child 6 to 72 months. Airborne infection, respiratory infections are same. Dr. Musab Nazar, even instead of respiratory, they wrote airborne infection, both are same. Both are same. Okay, this question was there. So in ICDS program, it is 500 calories. This is the answer for a child. 600 is for reproductive age group females. This is for malnourished child as per ICDS guideline. Malnourished child. Depending on the choices may be a bit different. This is the answer. In a child, we give up till 6 years of age, 500 kilocalories and 12 to 50. Okay. In some choices, we are being told 200, 300 kilocalories were given, 6 to 8 grams protein. No, this is not correct. This was the older guidelines. Now we are giving, since last 11 years now, 500 kilocalories and 12 to 14, right? Okay. Please confirm if there was a question on this immunization session. There are two ANMs, 2 hours time. They have to complete a total of 40 vaccinations. They have one vaccine carrier. What will you do to avoid wastage of vaccine or medicine and do session effectively? Do session effectively. Mark the best strategy. Okay, we go back to previous question. Students are saying ICDS was not there, school was there. See friends, this you have to confirm because question was attempted by you. If it is school, it will become midday meal program. If it is ICDS, answer remains same. Answer remains same. Okay, so we look at this. We come to this. Immunization session, 2 ANMs, 2 hours time. 2 hours time, 40 vaccination. So you can see 120 minutes for 40 vaccination. They will get 3 minutes per vaccination. When a lot of children has come to the center, you cannot remove them from the list. No chance of immunization should be missed in the RCS program of India. Adding vaccine carrier will not speed up the process. Right? So what is logical? They divide the work. Documentation is equally important as vaccination. So let one of them work on the documentation, maintaining the records. One of them to work on the vaccination. Work on the vaccination. Okay, it was ICDS. Okay, majority of students mentioned ICDS. Okay, but one student is confirmed it is midday meal. Friends, you have to decide if it is ICDS, which majority of students say, then the answer is correct, right? Okay, let's move further. Please confirm a question came, 100 patients telephoned, asked about if they exercise daily and have coronary artery disease now or ever before. Identify the study design. Identify the study design. If this question was there, then the answer is cross-sectional study. Both we are looking at the same time. Slight language difference may be there. Students were saying 100 patients were given, 200 patients were given. No, it's not about vaccine carrier in the previous question, carrying the carriers. It is about managing the session effectively, which was mentioned in the question. So you have to give vaccination, you have to do record maintenance at the same time. Let them do division of labor. This is known as division of labor. Okay. What were the choices? Cross-sectional was given in the choices. That becomes the answer. Friends, please confirm if cross-sectional study was given in the choices. Okay, cohort study, it was mentioned observational, you are saying. One choice was experimental. Okay, then answer is cross-sectional study. Cross-sectional study. Okay, let's move further then if it was. Then there was a direct question on screening is which level of prevention. Students were saying some specific screening was asked. If you remember that, could you please confirm? Because otherwise, screening is secondary level of prevention. Otherwise, it is secondary level of prevention. Screening is early detection of disease in apparently healthy by means of rapidly applied test. Okay, Dr. Rohit is saying it was midday meal only, not ICDS. Then it will change, friends. In midday meal, it is 450 kilocalories. You have to remember, and 12 gram protein in children below 5th class, and up to 8th, it is 700 kilocalories and 20 grams of protein, if it was there. Breast cancer screening. Okay, great. So any screening, majority of them except maybe prospective belongs to secondary level of prevention. Okay, 1,000 women screened in a hospital for breast cancer. Okay, that makes it question, right? Okay, besides screening, they are saying in the question, there was also a mention of, students are telling, treatment also. Both belong to secondary level of prevention. Okay, it was a camp. It was not in a hospital. They are saying it was in a camp. So that will also be screening of breast cancer is also secondary. Treatment of breast cancer is also secondary. So 100% of you must have marked this answer correct. Let's move further. There was a question on net reproduction rate, but students were getting confused in the language. See, direct language, if you see, number of girl children produced minus mortality. Otherwise, you can say how many girl children are replacing. How many newborn girl children are replacing one woman dying? Both are same correct answers. You have to tell me which was given. Which was given. Okay, mortality was not there. Was any such language given? And woman who is dying is replaced by how many newborn girl child? If such language was there, that is also net reproduction rate. Okay, replacement was not there. Friends, you will have to help me with the language of the question or the choices then. Dr. Utkarsh, Dr. Aarti, please help me with the language. Inertization, okay, that must be a separate question. We'll see separately. Okay, language no one remembers. Okay, number of daughters an infant baby produce in future. So number of daughters that a girl is going to produce in her future reproductive lifespan, and out of them how many remain alive, that is also net reproduction rate. Same thing is said in different language. Number of daughters produced by a newborn girl child in future reproductive lifespan. So what does it mean? See, it has different ways of saying same thing. If a girl child is born today, in her life, how many girl child she will produce minus the deaths? If a girl is or woman is dying today, she is replaced by how many living girl children? Okay. So answer has to be related to this. What I will do, friends, I'll try to improve the language with the number of help from this total number of girl children born in the reproductive age minus mortality per every girl child. Yes, that will become correct. Okay. Was there a question like this? Please, friends, confirm. 4 things I was told were given in the boxes: evaluation, monitoring, planning, implementation. And we were asked to arrange them in sequence. Asked to arrange them in sequence. Evaluation, monitoring, planning, implementation. And we were asked to arrange them in sequence. Please have a look at this, friends. Evaluation, monitoring, planning, implementation. Okay, it was there. It was there. Okay. So can you now confirm whether these 4 words only were there? Evaluation, monitoring, planning, implementation. A student was, okay, delegation was also there. So implementation may not be there. It may be delegation. Is it right now? Okay, 3 you have to choose. How? Evaluation, planning, execution. And delegation. Okay. See, whenever you look at a planning cycle analysis of existing health situation, then you have to plan. Then you have to execute, and logically evaluation will come in the end. Depending on what else was given, will lie in between. Planning cycle starts with planning, ends with monitoring and evaluation, if it was given. Delegation also will come in between if it was there in the choices. How you delegate the word for implementation or execution, right? Okay. Okay, what does broad planning contains? Question was broad planning. Okay. Okay, great. So if you are looking at three, then these are the three best options in sequence: planning, execution, evaluation. Planning, execution, evaluation. If you are asked about three out of them, right? Was there a question on why health for all has changed to Millennium Development Goal, Sustainable Development Goal? Health for all. Why it has changed to Millennium Development Goal, Sustainable Development Goal? Making a plan will also remain same, Dr. UAKX. It will remain same. Okay, plan, formulation. Yes, first is to make a plan, absolutely. Okay, there was a question on this also. See, health for all was for year 2000. Okay, can you help me with the choices? Because students are not able to tell me choices. So I presume if any of the choice was like this, measurable targets, that will become a better answer. Why? Because health for all was a very broad goal. Everyone should be healthy by 2000. Then we decided, let us make it more specific. MDG by 2015, SDG by 2030. Yes, they were not a health for all, was not able to reach their goal. So they broke down into targets easy to achieve. Yes, health for all initially was not time bound. Okay, this was one of the options you were seeing. Later, but it became time bound that we should achieve it by 2000. Targets on time. Okay, target question was there. So measurable was not there. It was for only communicable diseases. That is not correct. It included non-communicable diseases also. Only for low socioeconomic countries. No, that is not correct. That is also not correct, right? So it has to be related to measurable targets or to quantify whether you have achieved them or not. Okay. Was there a question? This I am not sure that this question came because only one student was insisting in a group that you were asked about route of transmission for hepatitis A. So I will delete this question. Was there a question on route of transmission for hepatitis A? Such a easy question may not have been there. Please confirm. It has to be from some other subject if route of transmission was not asked. Not asked, na? Right, okay. Okay, this we have discussed. Was there a question on pleomorphism in chickenpox, friends? Was there a question on pleomorphism in chickenpox? Please confirm. Was there a question on pleomorphism in chickenpox? Can you confirm? And what was the exact question? Okay, it was there. Okay, it has already been discussed by other faculty. Let's move further. Was there a question on treatment of lepra reaction in multi-drug therapy in the leprosy program? If it has not been discussed by others, then it has to be prednisolone. Okay, students are asking, there was a question on botulism. What was the question? Route of transmission. Canned food was there in the choice. Okay, then that will become the answer. If canned food was there, then for botulism, canned food, yes, becomes the correct answer. It is also through sometimes spores in dust. In the dust, spores are there, or it may also be through a wound also. If though there's botulism, Clostridium botulinum manage to infect a wound or enter the wound, then also it can occur. Okay, derma has taken. Okay, let's move further.
Good evening, friends. So first question. Yes, a 4-month-old infant. You can tell me if any other modification. Please do comment. Hypotonia. Patient presented with hypotonia. Hypertrophic cardiomyopathy. Acid maltase deficiency. What is the... Thank you, dear. What's the diagnosis? Yes, we have discussed Pompei's disease previously. This is frequently asked question, recently asked question. Yes, pump, hypertrophic cardiomyopathy, and death usually occur due to heart failure. We all know. Yes. Thank you, dear. So, Pompei's disease, floppy infant, hypotonia, cardiac failure, hypertrophic cardiomyopathy, enzyme deficient, acid maltase. It is both glycogen storage disease and lysosomal storage disease. So mnemonic of two types. Type 2, yes, it is both lysosomal and glycogen storage disease. And in this, we pump with 2 hands. So you will remember hypertrophic cardiomyopathy and cardiac failure. So simple question, simple answer, repeat PYQ. Second question, a child present with self-mutilation, repeatedly bite fingers, yes, hyperuricemia, behavior issues, which of the following enzyme deficiency may be? So we have already discussed that HGPRT, Lesch-Nyhan syndrome, X-linked recessive eyelashes, yes, नयन X-linked होते हैं, so X-linked self-mutilation gout. Simple question, simple answer, repeat question. Hypoxanthine guanine phosphoribosyl transferase. Next question. Long limbs, arachnodactyly, lens dislocation. This is Marfan syndrome. So they have given diagnosis Marfan syndrome, and again repeat question, fibrillin 1. Yes. Fibrillin 1 mutation. Steroid hormone receptor bind to specific site of DNA by this question we have discussed. If you remember in DNA footprinting, I discussed that steroid hormone receptor just like a duck, and he's having finger-like projection, yes, footprinting, and these are zinc finger motif. So these are steroid hormone receptors bind to specific site of DNA by zinc finger, yes, motif. Yes. So zinc finger motif, this is taken from Harper steroid receptor family, do have zinc finger motif. Other option, helix turn, helix motif, helix turn, helix motif, leucine zipper motif. Next time they may ask, although not asked previously, helix turn, helix motif, lac pressure. Yes. MIC genes have leucine zipper motif. Yes. Now, thank you, friends. It's your hard work, and definitely you will clear this exam. And biochemistry was really, really simple paper. I feel like this. Okay. Night blindness, retinitis pigmentosa. If you remember, I told you R for refsum disease, R for retinitis pigmentosa. Yes. And other than that, phytanic acid is given. So simple question, simple answer. Yes. Yes. Two options. Yes, in this other options, even if given, no need to think, you will find the answer very easily. Okay. In this helix turn, helix motif, leucine zipper motif, examples I have given. Yes, this table from Harper. This page, this question. Yes. Yes. This question. Yes, I want your support. If image is this crumpled tissue paper appearance, this hepatosplenomegaly may be present in Gaucher disease, Niemann-Pick disease. If this is crumpled tissue paper appearance, then answer is Gaucher disease. But few students told, sir, it was foamy appearance. Yes, bubbly appearance. Mnemonic was neem soap. If you take bath with neem soap, your bubbles would not be so clear as Nirma girl because you take bath after so long time. So that's why your bubbles are not so clear. Huh? So Niemann Pick's disease, bubbly appearance. Yes, gouge, ouch, ouch, bone pain. Yes, few students told that some detailed history was also given. Yes, bone pain was there, hepatosplenomegaly was there, crumpled tissue paper. Yes. Okay, what was the round bubble, bubbly? एक सोप बबल थी. ओके, तो इमेज एक बार सर्च करते हैं. इफ यू हैव एनी आइडिया अबाउट द इमेज, कुछ मिले तो बताना दोस्त. यस, ए न्यूनेट प्रेजेंट विद लो सिट्रुलिन लेवल लो है. यस, अगेन इसमें तुम्हारा सपोर्ट चाहिएगा. Normal orotic acid level, high glutamine. What is the diagnosis? Hyperammonemia. Yes, in hyperammonemia, wherever ammonia is increased, it bind with alpha ketoglutarate to form glutamate. Again bind with ammonia to form glutamine. In urea cycle defect, glutamine is increased. So this is not a problem for us. Yes. Yes. Okay. Glutamine. Okay. Orotic acid urea. Okay, I put. Yes, not orotic acid urea, organic. Even then, this is typical picture. Yes, type 1 hyperammonemia. You can solve all the description by this type 1 hyperammonemia. Let me tell you the answer first. Yes, if type 1 hyperammonemia, CPS1 is deficient, then ammonia will be increased, hyperammonemia. This carbamoyl phosphate will not be produced, citrulline will not be produced, orotic acid will not be produced. That's a hyperammonemia. Yes, low citrulline level, hyperammonemia, normal orotic acid level. Yes, maybe due to this pyrimidine synthesis. Now I will rule out other option, type 2 hyperammonemia. In type 2 hyperammonemia, there is orotic acid urea. Orotic acid urea. Okay. If hepatic encephalopathy is there, definitely these are symptoms, but even then you will prefer to mark type 1 hyperammonemia. Okay? Because this is typical picture. Now, which of the following is defective in patient presenting with eruptive xanthoma with increased chylomicron? Yes, if chylomicrons are increased, eruptive xanthomas are there. Chylomicron increased eruptive xanthomas. Yes, eruptive xanthoma. Yes, this is eruptive xanthoma. Chylomicron increased. Then there is maybe defect in lipoprotein lipase or ApoC2. Lipoprotein lipase and ApoC2 or ApoC2 defect. Yes. ApoB100 defect will lead to, even if ApoB100, there would be increased LDL, increased cholesterol, tendon xanthoma would be there. Yes. ApoE defect, type 3 hyperlipoproteinemia. This question is type 1 hyperlipoproteinemia. Type 1 hyperlipoproteinemia. Yes. So answer is lipoprotein lipase. One more question. Defect in conversion of uroporphyrinogen third to coproporphyrinogen third. Which enzyme is defective? Decarboxylase. Yes. If you remember, we discussed that Porphyria cutánea tarda, काटा तोड़ा, क्या काटा क्या तोड़ा, carbon dioxide काटा, carbon dioxide तोड़ा. It convert uroporphyrin third to uroporphyrin, coproporphyrin third, uro to copro. Okay. Yes. Clear? So if you have any other question left, please do comment. I will include in the main recall. These few options are missing. We will complete in the main video. Thank you, best wishes, and definitely you will clear this exam. So now I hand over to Atul sir. Good evening, sir.
प्रणाम सर
Pranam sir, pranam.
कैसे हैं सर
बढ़िया sir.
सर
Thank
मजा
you
आ गया
friends.
सर आपका सेशन देख करके
Thank you sir. Thank you.
या ठीक है थैंक यू सर जस्ट अ सेकंड आई एम जस्ट शेयरिंग I hope I am audible. And good evening, all students. So I can see Bhedia. So that means I am audible. So, but overall, as I understand, the paper was little bit moderate to tough, but forensic was doable. I understand the forensic was still doable, and most of them were from previously asked questions. I've been able to gather around 8 questions, and if you have more questions, please do let me know. So I think one of the question was that if a severely burnt body is found, then what kind of autopsy we will do. So please remember that dissection is done in almost all cases. Apart from that, you can do additional CT, MRI, etc. to help. So that is, and this is virtual autopsy. Okay. So virtual autopsy doesn't mean that dissection will not be done. Dissection is done. But apart from dissection, we also do virtual autopsy to see, and this is especially helpful if the body is severely burnt, because if the body is severely burnt, then it's very difficult to see the things. So there the CT scan is very, very helpful. So if someone is mentioning that fracture was also mentioned, so in a very severely burnt body, if you have to see the fracture, it's difficult by naked eye. In a severely burnt body, if the body is severely burnt, in a severely burnt body, if the fracture difficult by naked eye, okay, CT scan or radiology will be better. Radiology will be better. I don't know what other choices were there. This traditional photography is not autopsy, so this cannot be the answer. Virtual autopsy looks like the answer. So photography is not autopsy. ओके नमस्कार जय गुरुदेव सो नो मोर रपड़जेंडूर्स क्या बात है सब भेड़िया बन गए तो हम भेड़िए के सरदार हो गए फिर तो virtual autopsy should be the answer, but I don't know if there is any other question or what are the other choices. If you can tell me from these two choices, the answer is definitely virtual autopsy. So any other choice, if you remember, you can tell me. Okay. Okay, here I think please remember abrasion collar. This is a firearm entry wound. Abrasion collar are present in all the distances. All the distances. So this does not help. But please remember if we have the choices like tight contact, close contact. What's the difference between these two? In tight contact and close contact, both of them, all three, singeing, blackening and tattooing are present. In tight contact, these are present only on margins. In close contact, they are present around the wound. Okay. But in intermediate range, there is only tattooing. And in distant range, nothing will be there. Neither singeing, nor blackening, nor tattooing. So as per this question, only tattooing was there. So answer becomes intermediate range. So this is also a previous year question, and this is also a previous year question only, previous year PYT, not Q but PYT. This is a PYT. So I hope everyone got it right. And this is a classical previous year question. Whenever the figure is like this, then it is voles. And I don't know if exactly this image was there. And so these all images I showed you in the class. This is loop. This is voles. And this is arches. An irregular mixture of all these is composite. Okay, so I hope this image was there, holes image. It was loop. So that I can get to know only if I get the image. So it's very, I don't know what was there, but you just remember like this. This is voles, and the loops is like this. Loops is like this. Arches is like this. Arches is, this is arches. This is arches, and this is loops. Okay, it was composite, sir, loop plus arch. I don't know because I don't have the image. Somebody gave me this image that it was voles, but if arch was, see, the chances that examiner will give composite is less. Chances that examiner will give composite is less. Composite is very rare kind of thing. So first image was there. This one, if this was there, then it will be loops. If this is there, then the answer will be loops. If this is there, then the answer will be voles. This is voles, and this is loops. Okay. But anyhow, when I get more clarity, you can just let me know. And if it is there, then this is arches, not this image. Okay, but you got the whatever it was. So what was it? Maximum people just tell me what was it? It was arch. Okay, arch tha. So maximum people are saying it was arch. So we will understand, we'll assume that it was arch. Maximum people are saying it was arch. So arch is the answer. So this was not there. We will assume something like this was there. Okay. Ha. So I did not give the exam na bhai. So but I got the recall questions from bhediyas like you. ठीक है? तो arch is the answer. Maximum people are saying arches. तो तुम भेड़िए हो तो ठीक ही बोलोगे. Arches is the answer. We will go by that. Now, cross dressing. Cross dressing is transvestism, also called eonism. Okay. Now, it can be if it is done for the purpose of sexual gratification, then it is called transvestic fetichism. Fetichism. But it can also be done for other reasons like some mental illness, gender identity disorder. But so ideal answer for this question is transvestic fetichism. But as I know, this choice was not given. So the second best answer is transvestism or eonism. So if in that case, eonism will become the answer. In case of fetichism, it is not cross-dressing. It is like footwear, undergarments, objects of objects of opposite sex. It is objects of opposite sex. But here the person is wearing the clothes of opposite sex. So we'll mark eonism as the answer. Chalo. And here the person can have sex with any woman, but not with his own wife. So fetichism was there, but fetichism will not be the answer. Transvestic fetichism will be the answer. Transvestic fetichism was not there, no. Transvestic fetichism was not there. So the second best answer, we will have to mark eonism as the answer. Fetichism cannot be the answer. Fetichism means from the objects of opposite sex. And here the person can have sex with anyone but not with one particular woman. So this is quad hank. I don't know what the other choices, but this is a simple PYQ. So again, so this is also PYQ. This is also a PYQ only. So forensics were all PYQ, I will say, which I all teach in the class. Now here it's morphine, that is an opium CNS depressant. So here there will be all vitals are decreased, pupil size is decreased, and in vitals there is a decrease of blood pressure, heart rate, respiratory rate, and body temperature. But so from this, tachycardia cannot be the answer because the heart rate is decreased. Pupil size is decreased, so pupil dilated cannot be the answer. So people would have got confused between pupil constricted and bradypnea. क्वाड वाले दो ऑप्शंस थे सर. ठीक है, अभी उस पर दोबारा आएंगे. Let's first discuss this. So bradypnea and pupil constricted both are seen, but from clinical relevance, what is more important? Bradypnea is more important. No, I have told you consistently, low respiratory rate is the most characteristic sign of opium poisoning. Low respiratory rate is the most characteristic sign of respiratory for the opioid poisoning. If you remember in the class, I say whenever you see respiratory rate very low, like less than 10, always think of opioid because the treatment is guided by the respiratory rate. If the respiratory rate is too low, patient may require ventilatory support. If the if the respiratory rate is too low, patient may require respiratory support. So the answer becomes bradypnea. Pupil constricted ऑप्शन में नहीं था, meiosis नहीं था. अच्छा, so what was the answer? What was the question? Unequal pupil size. Unequal. So even unequal pupil size is very non-specific. Unequal pupil size is very non-specific choice. Okay, different size of pupil size is also very. Respiratory depression is, or bradypnea or respiratory depression, whatever it was, that is the most characteristic of opium poisoning. Okay, somebody is saying that in there were two choices with quad hank. Can you tell me what were the two choices with quad hank? What were the two choices with quad hank? Anyone? There were two choices with quad hank. अरे जवाब तो दो ना जय गुरुदेव. तो ठीक है, पता नहीं. ठीक है, इसमें if the person there is an accused of sodomy, so what will you take to confirm sodomy? How will the sodomy be confirmed? Simple thing, quad doctrine. So please remember the answer is quad hank. There was something quad doctrine. I don't know what is quad doctrine. I have no idea. But the answer will be quad hank. Answer will become quad hank. So that is a simple PYQ. Okay. So this is also PYQ. So forensic is all PYQ. So here, how will they only one test to one confirmatory test for sodomy? See, there are many signs of sodomy, like lateral traction test is positive, loss of perianal fold, all those things. But those are not confirmatory. What is confirmatory? Confirmatory is only one thing. When you can detect the semen near anus. That is the only confirmatory thing. All other things will be suggestive. They will not be confirmatory. So how will you get the semen? By rectal swab, rectal or anal swab, whatever it was. I don't know if the choices are correct or not. Are the choices fine? Choices are fine or not? Tell me. Choices are fine or not? Okay, so in that case, the answer will become rectal swab. Clear? Now, shoulder joint X-ray. Now, this is a bit controversial because I could not get the image. But I will tell you one thing. What you could have seen? What you could have seen, that I will let you know. So here, one is, what do you see in shoulder joint? You see humerus. You see acromion process and coracoid process of which bone? Scapula. And you see outer end of clavicle. Outer end of clavicle. These things you can see in the shoulder joint. So outer end of clavicle will not help us, give us any information. It is the inner end of clavicle which helps, not the outer end. So outer end of clavicle will not help. In humerus, there is head, greater tubercle and lesser tubercle, which appears at one ear 3 years and 5 years, and they fuse with the shaft at 17 to 19 years. Most likely, these three centers were present. What I could understand from the people is that head in the humerus, if we talk about the humerus, the head, greater trochanter and lesser trochanter were present but not fused. Not fused. So not fused means the age is less than 19 years. Age is less than 19 years. Then the very important will become acromion process and coracoid process. So here you have to remember that acromion, most likely the acromion process and coracoid process. Please remember, acromion process appears and fusion 15, 18, 11, 16. So acromion process appears at 15 years and fuses at 18 years. Fuses at 18 years. The coracoid process appears at 11 years and fuses at 16 years. So what I could understand from students is acromion process was not fused, but coracoid was fused. Coracoid was fused. Okay, something like this was there. Acromion was not fused, but coracoid was fused. So this is what I could understand. Okay, so in that case, if this is the right, if this it was, then the answer will become 16 to 18 years. So this is a bit tricky. Why it's a bit tricky? Because normally shoulder joint is not very commonly asked for. So though it is a previous year topic, but I will call it bit moderate to difficult level, because shoulder joint, though it is a part of PYT, but it is not commonly shown as an image. Normally we show the image of elbow joint or X-ray or wrist joint. Okay. So 16 to 18 looks like the age. सर इन लास्ट क्वेश्चन सीमन भी था ऑप्शन में. अब ये तो फिर एग्जैक्ट क्वेश्चन चॉइसेस बताना पड़ेगा. फोर्थ ऑप्शन वाज सीमन टाइप. I don't know. Semen type, because in rectal swab also we are going to check the semen only. So in that case, आधे से ज्यादा क्लेवल देख रहे थे सर एक्सरे में. Clavicle has no role. Please remember, clavicle in shoulder joint, you will see the outer end of clavicle. That does not give any information. Clavicle inner end gives us the information, but that you could not see in the shoulder joint x-ray. Okay, so it was mainly the game of acromion. So that's the reason I am saying it is a bit difficult question. बस हो गया. Any other question you remember? देखो forensic तो you all are भेड़ियाज. Almost I discussed 8 questions and all of them were PYT. Anything, any other question you remember? कोई और question याद है? Okay, so if there is no other question, rectal swab with epithelial cell था कुछ नहीं. अगर सीमन चॉइस में था तो फिर सीमन मार्क आंसर हो जाएगा. इफ सीमन वॉज देयर इन द चॉइस, देन द आंसर विल बिकम सीमन. वन ऑप्शन रेक्टल स्वैब विद सीमन एंड एपिथेलियल सेल्स. देखो अगर कहीं पे सीमन था तो सीमन बिकम्स द कंफर्मेटरी. अगर सीमन वॉज देयर तो सीमन विल डेफिनेटली बी द आंसर. दैट विल बी 100% कंफर्मेटरी. तो दिस वॉज अ कॉमन सेंस क्वेश्चन. बेसिकली दिस इज अ वेरी कॉमन सेंस क्वेश्चन. ठीक है, तो सीमन अगर है तो सीमन तो ही, सीमन से ही तो पता चलेगा ना सोडोमी हुई है. सीमन अगर मिल गया तो सोडोमी हुई है, नहीं तो सीमन कहां से आ जाएगा एनएस के पास. कमाल करते हो. हाउ विल सीमन कम इफ देयर हैज नॉट बीन सोडोमी? ओके, सो थैंक्स ऑल एंड नाउ आई विल वेलकम डॉक्टर अमृत नाश्ता सर टू टेक द सर्जरी क्लास. वेलकम सर.
थैंक यू सो मच अतुल सर. आपके इतने में ही मुझे कितना सारा सीखने मिल गया.
नहीं सर, क्या मजाक करते हो. थैंक्स सर.
Okay guys, how did the paper go? So I got quite a lot of questions and some are little incomplete, don't mind that, but quite a lot are quite legitimate. Okay. And if any of these were discussed before, then you can let me know. I'll skim through them. And second thing is, I always say general surgery is far more scoring. This paper had so much general surgery. I hope you would have studied it from me or an anatomy or an ENT and you would have gotten the questions right. Okay. There were some tricky questions, but those are not our target. Our target is the basic standard normal questions. Tough questions थोड़े होते ही हैं, but that's okay, right? We don't need to get all questions right. We need to get the straight normal questions right. So let's see. थोड़े tough थे, not gonna lie, but the easy ones वो तो आने चाहिए, right? So mother went to a pediatric surgeon. Child had a groin swelling, and when the child would cry or urinate, basically strain, the swelling went down medially. What is the likely cause? And I'll just give you a disclaimer. These are not exact questions. They were big clinical STEM questions, so they would have troubled you. I have just gotten the crux of the question. Okay, so don't say this is not the exact question, because I'm only telling you this is not the exact question. None of these are exact. I'm just going to give you what I got in the recall, the crux of the question, so you understand the topic. So if a child, 1 or 2 year old, has a hernia, it will be an indirect hernia. Option B here is the correct answer, patent process vaginalis. Okay. Direct hernia is seen in senior people. Male or female or doesn't matter, answer will be indirect inguinal only. That is a congenital hernia. This is their favorite topic. They ask this day after day, night after night, exam after exam. So patient had a breast cancer. 4.5 centimeters means it is T2. Okay. 4.5 centimeters means it's T2. Mobile lymph node means it is N1. So they didn't ask you what is T2 N1. They asked you the stage. So this is something you had to know. Stage 3 is locally advanced. Stage 2 is early cancer. So if it is T2 N1, which you see in this table, it will be 2B. So your answer is stage 2B. ठीक है? बहुत घिसा पिटा question है. This was one of the tricky questions. I mean, this is the kind of question they ask in INICET. So if this question you made a mistake in, you should not feel bad. It's okay. If you use some common sense, which I have taught you in class, maybe you would have gotten it right. But this was one of the tricky questions. In fact, students could not understand what the question was saying. There was a long stem. Patient had a breast lump. It was removed. It was a lot of DCIS findings were given. And there was this word, 2 millimeter margin. This was given. This was one of the important points. Margin is 2 millimeters. What is the next step? Now, there is a way to calculate what you have to do next. But 2 millimeter means it is close margin. Means some cancer cells may be left behind. It's possible. If cancer cells are left behind, what will you do? Give radiotherapy. So best answer here is radiotherapy. Don't say BCT. BCT is not done in DCIS, because in BCT you have to do lymph node biopsy. In DCIS there is no lymph node biopsy. Mastectomy could be the answer, but from the available information, radiotherapy is the best answer, because some cancer cells may be left behind. Easy question. They are given an image. Patient had dilated veins in the leg. Now either it is C1 or C2. From my understanding, students are saying they were very small. They were not varicose. They were reticular varices or spider veins. They were like spider nevi. So if it is spider nevi, it will be C1. Okay, chemo भी नहीं आएगा. DCIS में chemo भी नहीं देते, because there is no metastasis. There is no lymphadenectomy, correct? So it's either radiotherapy or mastectomy, but in my opinion, radiotherapy would be the expected answer. So more than 2 millimeter ही होगा ना? That means maybe little bit margin may be left behind, maybe. So here the answer would be C1. Was there a question on which vein is dilated? Anatomy question. ऐसी कोई question थी where which vein is dilated? Let me know in the comments. I will see. Okay. The reticular varices should not have swelling. If it's reticular veins, it is C1. Then this was easy question. They had given an image of a skin graft on the leg, which was meshed, right? It was meshed graft. So obviously there the answer is going to be split thickness. This lot of students confirmed. So there was a question on great saphenous vein. Okay. Okay, that I think is anatomy, but okay. We have covered it in our class. So this was split thickness. I don't know what the other options were. Students were like, 2 options were irrelevant. So I was like, very good. Again, I'm saying question had a big clinical stem, a lot of the questions, but I have made it short because that is as much as recall as I have gotten. I know Exact questions were much bigger. So don't mind that. This was one of the nice, tricky question where they tested your understanding. Big clinical stem, burns patient, inhalational burns, soot over face, nasal hair was singed, carbon monoxide was high, oxygen saturation was low. Lot of things were given, and they are asked what is the next step. Obviously, in burns, how we resuscitate A, B, C, D, E. So first airway, then breathing, then circulation. Correct. So a lot of people felt answer should be A because he is having low saturation. But understand in inhalational burns, person is at risk of laryngeal edema, which manifests later. So the best answer here would be intubate. Okay, that would be the best answer. If there is hyperbaric oxygen, that is also fair. Okay, that is also not entirely wrong. But in my opinion, best answer would be intubation because he is at risk of laryngeal edema. One option was IV B12. Okay. Patient alert and tachypneic. Okay, more the reason to intubate. Okay, more the reason to intubate. Burn in neck, everything tells me there are inhalational burns. The history was suggestive of inhalational burns. This was normal. We have covered this in our chest trauma. So person has a stab in the neck and they had given the zone, and with common sense, you would have answered this question that there is air bubbling, means it's a tracheal injury. So what will you do in tracheal injury and what is the zone of the injury? This is zone 2. Zone 2 is the most common zone. And if there is tracheal injury, you are going to explore. So answer here will be zone 2 and exploration. Yeah. Deep burns neck and face, more the reason to intubate. It is only telling you that there is a airway injury because all those burns will cause problems. There is an inhalational injury. Okay, so your answer will be zone 2 explore. This is controversial. I don't know if Vivek sir discussed this. So if he's discussed, please let me know. And I'll tell you, I've taught this in class. I've even shared the table of degloving injury comes in what, but there are two schools of thought. So you have to choose what the question was actually asking. There was a lower limb wound, looked like a degloving wound, but students told me muscle was also cut. And what is the category of triage? See, degloving by itself is yellow. Okay, degloving by itself is yellow category. But if it is bleeding, obviously it becomes red. Goes without saying, you have to stop the bleeding. You can't put him in yellow and look at him after 1 hour. So if there is bleeding, answer is red. Goes without saying. Okay? Skin was off, muscle was hanging, bleeding. Yeah. So video, it was not a video, na? The video question, blood is coming. But yeah, if bleeding is there, automatically it becomes red. This I'm sure must be covered in anatomy. Constriction 40 centimeters is a diaphragmatic crura. So this we can skip. Easy question. There was a neonate with a very big cystic hygroma and they had asked for treatment. So treatment of cystic hygroma is to remove it. Students were like immediate or operate at 1 year. What do you think should be the answer? Will you operate immediately or operate at 1 year? By simple logic. The child is born. He has a big cystic hygroma on the neck. So what should you do? Yeah. And if there is any other option or anything more in the question, then you can tell me. So obviously, if the child is born with a big cystic hygroma, you will operate immediately because it can compress his airway. Maybe it caused difficulty in delivery also. We don't know that, but immediate operation would be my answer. Operate at 4 year. Okay. Why would they even put that? Operate at 4th year. Means they are just, playing with you. Okay. Aspirate or excise. Excision is the answer, but if there is a choice of immediate operation or excision, that is the best answer. This is a PYQ. This has been asked 3-4 times. It's there in all our ENDs, you will see. So there was a child with a cyst, outer canthus of the eye. That is a congenital dermoid cyst. Okay. Earlier they have asked. This is also a PYQ repeat. There was a swelling in the floor of the mouth. They had asked a diagnosis. I think it is ranula. Okay. This, I've gotten different versions of the question from different people. Okay. Different versions from different people. I'll tell you what is my thinking. This was also a clinical STEM question, that they gave a lot of history and then they had given an X-ray or an ultrasound of submandibular gland stones, right? So there was submandibular gland stones and they had asked the treatment. Now, in principle, the treatment is removing the stones. You don't have to remove the gland. One option involved parotidectomy, one option was removing submandibular gland fully, one was partial. So submandibular gland fully is not necessary. Okay, that should not be the answer. Option A would be the best answer, and how to remove it depends on the size of the stone. Okay, the technique of removal is dependent on the size of the stone. Superficial submandibulectomy, yeah, we don't need to do it. With inflammation of gland, that is because of the stone. So this is little controversial, but in my opinion, answer should be A. Remove the stone, the inflammation, everything should subside. Okay, this you have to tell me what the exact wordings were because the answers can change completely. Okay, the answer can change completely. So they had used these words, thyroid neoplasm. And question was asking how to look at extrathyroid spread. Was it extrathyroid spread or was it metastasis? Because if it is distant metastasis, then you will do iodine scan, whole body radioactive iodine after 3 to 6 weeks. If it is extrathyroid spread, then it should be MRI. Okay, stone size 1.4 centimeter, then you have to do open surgery to remove it. Okay. That answer I'll confirm with ENT, sir. Okay, the stone wall answer. So if here the question is extrathyroid spread, answer is MRI. Means you want to see how much it is going around the thyroid. Iodine scan would be for metastasis. Okay. This confirmed this question. There was a big clinical scenario. It was suggestive of tension pneumothorax, and they had given a chest X-ray also where you could see collapsed lung and black lung fields, chest fields, and they had asked what is the next step. So best answer is needle decompression. They didn't give triangle of safety, so second intercostal space is the next best answer. Okay, because this is new guideline, but they didn't give space to not confuse you. So option A would be the best answer. I don't know what the other options were. Students were like, in dono mein we had to think. Okay, we had to think in between these two only. So answer here is second intercostal space. Easy question. Post, they're given there is a D1 ulcer on the posterior wall which is bleeding. What artery is affected? Gastroduodenal artery. So that is the easy one. Then there was a clinical scenario. They had given the triad of Boerhaave syndrome, chest pain, subcutaneous emphysema, and everything. And they had asked, how do you diagnose it? It is CT. CT with oral contrast, not endoscopy. Endoscopy is for corrosive injury. Here it is CT with oral contrast. Another easy question. After thyroid surgery, woman is not able to sing in a temple. What nerve is injured? This is going to be superior laryngeal nerve, where you are not able to raise the pitch of your voice. Recurrent laryngeal nerve will cause hoarseness. This question, a lot of students could not properly understand. So whatever information I got and what I believe, I will tell you. Big clinical question. Elderly male, malnourished, steatorrhea. You thought it could be a malignancy. They had given a CT where there were things on the pancreas. Probably it was calcification. The levels were all normal. And they had asked, what is the next step? Okay, this was the question with an image of CT. There was a question like this with image of CT. With some things on the pancreatic head, swelling of the head. So it sounds like chronic pancreatitis, especially if it is with a history of alcohol or something like that. Yeah, no malignancy is mentioned. Okay, so what is the next step? It should be enzyme supplements, in my opinion. If he has too much pain, you can do surgery for pain relief. Total pancreatectomy will not be the answer. Okay, total pancreatectomy will not be the answer. Autoimmune pancreatitis, sausage-shaped lump. Give corticosteroid. No, that is a different question. Okay. Fluid type. But if everything is normal, what it is acute pancreatitis with fluid collections, hard to say. If there is steatorrhea, it is chronic pancreatitis. Then there were some more questions which I didn't get completely. Okay, and some were not really surgical. There was one cobra head on intravenous urogram. Steroids would not be used here. Steroids are not for chronic pancreatitis, especially if there is history of alcohol. And Whipple's is also not normally done for chronic pancreatitis unless there is pain. So one was IVU cobra head image. Then there was a very nice question. Now I don't have the exact question to give you the answer. Patient is undergoing TURP. Something goes wrong. He becomes drowsy. Basically, he's having TUR syndrome. And his sodium levels were borderline low, 120, 125. So there was a borderline low level. Now, they had asked, what is the management? One option was abort the procedure, which according to me is the correct answer. Abort the procedure, fluid restriction, he will be fine. If there is fluid overload, means if there was pulmonary edema features, then you will give diuretics. Okay, so 125 sodium was given. For 125, the treatment will be fluid restriction. Okay, it is fluid restriction. And abort the procedure, then don't continue with the surgery. You know you have a time limit in that. Okay. Then this question again, a lot of people, too much information got you confused. This I will have to check. You will have to help me with this. During lap cholecystectomy, surgeon accidentally cut some bile duct. And the question was, he is not very experienced. What should you do next? Two things can be done here. One is abort the procedure and put a drain. Other is convert to open. In which way the answer will go depends on what other information they are given. If he is inexperienced in laparoscopy, he can convert to open. But if he is inexperienced surgeon, then he will have to abort the procedure. It is one of the bailouts. Child with prolapse, that is pediatric question. That was a partial prolapse. That is pediatrics. You don't need to operate for that. Okay, and then facial nerve identification intraop, that was tracheal pointer or Conley pointer, easy question. So all in all, I have about 25 questions. Abort and drain is correct. I mean, it sounds correct. But if he is inexperienced, conversion to open will also not help. He was inexperienced in laparoscopy, then convert to open sounds better. Convert to open, no, don't repair bile duct. No, he has to be referred to higher center. I was asking about should he do open or continue? No, don't. He won't continue laparoscopically if he's inexperienced. Right. So I have about 25 odd questions, and I feel 18 to 20 were very acceptable, very attemptable, and 2-3 were tricky, and 2-3 were a little on the harder side. Biopsy from lesion of tongue, if it's ulcer, you take from the border. That is biopsy from the border. Okay. One option was ERCP stent. Yeah, I heard that. But if common bile duct is transected, then ERCP with stenting will not work. That is only for cystic leaks. If there is a tongue lesion, you will take a biopsy from the border, wedge biopsy. Okay. So now the last one, the last warrior, Dr. Janvi will take over.
Okay, hello everyone. Very easy questions from anesthesia. They were all PYQs. I hope you all got them correct. Even when I asked them on the group, people were like, हाँ anesthesia, हाँ PYQ में से आ गया. Easy. Okay, so very easy questions. We've discussed it already in our notes as well. So the first question was to identify this needle. So this is the Tuhoy epidural needle. How to identify this epidural needle? I had told you all that it has two flanges or two wings to hold it, and you have alternate light and dark markings, and it is used for giving epidural anesthesia. Second question was this: what is the drug of choice as IV induction agent in daycare surgery? So the answer for this is propofol. Simple, straightforward. As you all know, Propofol is short acting and it gets metabolized easily. Patient wakes up quickly from propofol. It is anti-emetic, antipruritic, and also it has least side effects, so preferred in daycare surgery. Then the question was to identify the Malampatti grade. As I had predicted, every time they give Malampatti in the exam, I told you all in the marathon class as well. So they had given the picture of Malampatti class 1. As you guys can see in the picture, the entire uvula was seen over here. So that was the Malampatti class 1. The whole uvula was seen, the base of the uvula, body, as well as the hanging tip of the uvula. So it was easy. Malampatti class, and they had also asked Malampatti class 1 is easy or difficult airway. So it was Malampatti class 1, easy airway. Okay. The fourth question, I did not get it completely. It was something about a patient undergoing surgery and suddenly his EtCO2 dropped from 15 to 5. Now, I need to know the complete question for that to be able to answer it. Some of you all said it is because of anesthetic agent. Some of you all said it was because of pulmonary embolism. But I think that I will be able to answer it better when I get the complete question. And I will do that in the formal recall. So till then, we had very simple questions in anesthesia, and I hope all of you all made these correct because they were all taught before. Thank you and take care.
Muktaji, anyone else is left for the recall? Mukta, Shubham, anyone else is left for the recall? If we are done.
Yes, sir.
Yeah, okay, sir.
So
Yeah.
if we are done,
Thank you,
then
sir. Yes.
thank you everyone for listening and hope you will come soon for interviews after you clear the exam. All the best, guys.